droplet and airborne precautions, support healthcare legislations in terms of lockdowns, and help in developing partnerships, involve in research. Those researches could be just how to improve oxygenation. Those results could be just of what are the various kind of presentations that we have, encouraging use of multidisciplinary efforts, influencing local and national economic and political options. The role of public health authorities. We need to have more and more national programs so the money can get dedicated out over there to contain these illnesses for preventing and controlling, especially the vector-borne diseases and zoonotic diseases. Legislations for elimination and containment. Communities should be aware of the disease, minimizing transmission of infection by risk communication to the family members, minimizing the vector population, minimizing the vector so that there are less individual contacts. And very, very important is the lab surveillance and reporting to the nearest public authorities. Public health measures to prevent infectious disease in general should continue. So safe water, sewage treatment and disposal, food safety programs, animal control program, vaccination program, and strengthening of public health organization and infrastructure. How does the WHO pull in during this time? So it develops global and regional strategies, which is disseminated across to all areas for containment of the disease. They appoint the task force. Generous grants from regular WHO budgets, supporting the World Bank Grant, and go on. The Global Outbreak Alert and Response Network. There's a mechanism for combating international disease outbreaks. It ensures rapid deployment of technical assistance, contribute to long-term epidemic preparedness and capacity building. So, to have a look at the overall key tasks in dealing with emerging diseases. First is surveillance at national, regional, and global level. That could be epidemiological surveillance, laboratory surveillance to understand the molecular composition, how rapidly the virus or the organism is spreading, the antimicrobial resistance and gene detection by PCR, ecological and anthropological surveillance. Investigation and early control measures, implementing preventive measures, whether it's behavioral changes, whether it's political changes, whether it's environmental changes, and monitoring and evaluation. So in a gist, I've tried to put in the role of National Epidemic Alert and Response Team, which starts with detection. So early detection is very, very important. So we need to be very clear with the early warning signs, wherein the entire surveillance team and the healthcare services pool in. It's very important that unofficial rumor sources are closed. After detection, it's very important that there's verification, assessment, and investigation to have a right kind of a response from the various resources that we have in the community, as well as the international resources like WHO. And of course, at the national level, when we have authorities and decision makers. Media and the general public pool in to disseminate to curb any kind of unofficial rumors and sources and be armed to contain the disease. Research is ever important in emerging diseases. So it will help us in diagnosis. It will help us in new approaches to vaccination. It will understand the immunological component behind the disease. What are the various drugs that need to come in, advances in molecular biology, and microbial pathogenesis. Similarly, the basic research will help us in diagnostics, drug development, clinical trials. Clinical trials should be conducted very ethically to develop drugs, vaccines, and diagnostic mechanisms. Overall, we have seen many kind of problems. Having known the problems subtly at each level, let us understand what are the various solutions that can be pulled in so that we are able to curb these diseases at the earliest. First is we need to strengthen our international surveillance networks so that warnings can be issued on time, we can detect, control, and reduce emerging infectious disease. We need to improve international public health infrastructure. We need to improve international capabilities to respond to the disease, and we need to strengthen international research efforts. We need to focus attention and resource on training and developing medical and nursing and veterinary capability, encourage national governments to improve the public health care system, develop better international standards, guidelines, and recommendations. Migration, proper screening, vaccination, traveling, immunization, infection and control measures, urbanization, proper sanitation, adequate housing, good infrastructure, human behavior by education, behavior modification, and antibiotic judicious use, and strengthen infection control measures. Public health surveillance and response systems are very important to rapidly detect, track, and respond. Internet-based information technologies are very, very important to improve reporting and facilitate emergency communications and dissemination of information. You can't leave Human Genome Project. They will study the susceptibility, progression, and post-response and the genetics of the microbial structure. Methods for disease detection, control, and prevention needs to be improved, and geographic imaging systems need to be developed. We need to monitor environmental changes to curb diseases. And that's how we need to partner all together with CDC at the background to contain the diseases, prevent the diseases. Emerging Infectious Network was born in 1995 when CDC granted a cooperative agreement program award to the Infectious Diseases Society of America to develop a provider-based emerging infectious sentinel network, the Emerging Infectious Network. So it's very important that when we work, we need to work in synergy, the regional, national, and global level. Before I close, the CDC emerging infectious priority issues today are antimicrobial resistance, food and water safety, vectors and animal health, blood safety, infections that cause chronic diseases, opportunistic infections like today we have mucormycosis, maternal and child health, health for travelers and refugees, and vaccines. So the take-home message is we require multiple expertise to curb any kind of infectious emerging and non-emerging, re-emerging diseases. It's epidemiology at the base, international field experience, lab, a huge important role being played today of helping us to identify the disease and even gene studies. Information management I keep at the base because information management should be able to store and help us what are the lessons we learn. Telecom and geographic tracking should come in a big way. Public health is a strong component that should be there to prevent the diseases, the infectious diseases. These are my references, and I thank you for giving me this platform to share my thoughts on emerging and re-emerging diseases. Thank you so much. Of course, my gratitude to the Society of Bioleagues in association with SRM University, which has hosted this wonderful ISCI conference, the second ISCI conference on nursing science and healthcare. My gratitude to all of you. Thank you so much.
Thank you, ma'am, for the inspiring and informative presentation, the need of this pandemic time. Thank you for sparing your valuable time, ma'am. Once again, we thank you.
Thank you so
much. And as instruction for the participants are requested to stay connected till the end. Certificate link will be shared at the time of valedictory.
Hello, madam.
Hi.
It's a very nice presentation. I am Dr. Kanyamal.
Thank you so much.
SRM College of Nursing. Here I would like to share some of the memories where I have visited your institution once as an inspector, Day2 Patel. Some critical care course has been started in the College of Nursing. So by the time I visited some 4 or 5 years, more than 6 years in the beginning. Starting of the time I came along with one of the other inspectors I visited from North. So I visited your institution. It's a very great opportunity to see your university also. So it was a very nice presentation in the morning. So, giving a lot of input for what are the emerging and re-emerging diseases, the clarity, with very much clarity, the parasite and all other virus details and everything. So because it's an overview, It's an
Right.
overview of from the what is the 100 years, more than 100 years, what how far
Absolutely.
it travels. So yeah, it's eye-opening for all of the nurses. It is a recent thing everywhere. The emerging and re-emerging diseases, it has become a cry for even, we have an alliance with Sweden,
Right.
University of West. There also they are interested in having online, now the global health course they have started, and there were two of our MSc students and the people from Namibia and Sweden, University of West, they are collaboratively we are participating with that, and they have a plan of conducting a emerging and re-emerging disease. Now we received a mail for that.
Oh, lovely.
So yeah, so for a separate course, they would like to have an online course. So they are really, it's a very good eye-opening topic, and we can learn more in this aspect for all these things. And based on the need only, they are also interested in starting the course of that.
Oh, lovely.
And yeah, so really, it's a very good presentation, ma'am. So nice of you, and
So much.
wish you all good luck for
Thank
your
you.
future, and then growth and development of your profession, and as well personal life. Wish you all
Thank
good
you.
luck.
Thank
Yes,
you. It means a lot to me. Thank you.
yes. Thank you, ma'am. Thank you.
Thank you, ma'am. We are going to continue our session with the second keynote speaker, Dr. Vidya Tirunavukarasu, Assistant Professor, King Faisal University, Saudi Arabia. The presentation is about linking research and practice through informative technologies. Now, I request Professor Vijay Lakshmi, Vice Principal, SRM College of Nursing, to introduce the speaker.
Pleasant morning to all. I thank Dr. Rita Lakani ma'am for her enlightening presentation, the first session, and our respected Dean ma'am for the words of appreciation, and Associate Professor Shiba Jepakani for chairing the session. And now I have a pleasant responsibility of introducing Dr. Vidya, Assistant Professor, College of Applied Medical Sciences, King Faisal University, Saudi Arabia. Dr. Vidya is an admirable nursing personality with over 16 years of experience in nursing education. She has rich experience in planning, organizing, and conducting workshops and seminars, and she participates in writes policies, procedures, and guidelines related to nursing field, and preparing competency tools for various procedures and assisting competency of nursing personnel and student nurses. And she has got a very rich professional experience. In the year 2017, she completed her PhD in nursing from Meenakshi Academy of Higher Education and Research, Meenakshi University, Chennai, India. And in the year 2003, she completed her Master of Science in Nursing, Specialty Medical Surgical and Specialty Critical Care Nursing. In the year 1990, she completed her BSc Nursing from SRM College of Nursing. And her professional experiences, she had served as assistant professor. She's serving as assistant professor from the year 2019 to till date in College of Applied Medical Sciences, King Faisal University, Saudi Arabia. And she had served as nurse manager, L&D, from the year 2018 to 2000, for 6 months at Kaveri Hospital, Alvarpet, Chennai. And she had served as reader from the year 2009 to 2011, Meenakshi College of Nursing. And she has served as principal from the year 2006 to 2009 at Shekhar College of Nursing, Bangalore, Rajiv Gandhi, under Rajiv Gandhi University of Health Sciences. And she had served as assistant professor from the year 2004 to 2006 in Shekhar College of Nursing, and assistant professor in JSS College of Nursing from the year 2003 to 2004. And also she has served as clinical instructor from the year 1999 to 2001, Apollo Hospital, Chennai. She has obtained certificate of training of trainers on tuberculosis under the Global Fund to Fight AIDS, Tuberculosis and Malaria, GFATM, Round 7, conducted by Christian Medical College, Vellore, the year 2015. She has completed a certificate course in Diploma Office Automation, and she holds a short-term course certification on health management and statistical software, SPSS 11.0, and professional membership. She's a member of Trained Nurses Association of India, and she's a member in Honor Society of Nursing, Sigma Theta Tau, and she is a member in Medical Nursing, Surgical Nursing Society of India. She has served as a secretary, and she has presented many papers in national and international conferences. She has published many papers in index journals. She is a vibrant orator and inspiring nursing personality. I am pleased to introduce Dr. Vidya. I welcome you to present the second keynote session for today. Thank you for the opportunity.
Hi Vidya, good morning, welcome.
Hi, ma'am. Good morning. Hope you're able to hear me, ma'am.
Yes, nice.
Good, nice seeing you all in India. Though the condition is in a very bad situation.
Yes.
Very happy to see you all in this forum, ma'am. Thank you.
Yeah.
And good morning to one and all.
You escaped nicely from this Indian scenario now. Yeah.
It's not like that, ma'am. Actually, it's not like escape because we are not able to come back to our country. At least this year we plan to come again. Still, we don't have flights.
No, not necessary now. Don't come because be safe.
That's what everyone is telling. Better not to travel now.
Yeah.
But it's okay here. The condition is within our control and within our limits.
Yes.
Probably the cases are not very high like there, and I think the practice also changed here, and most of them, I think 90% above are vaccinated and things like that in systematic manner. So it's within the healthcare professionals' control, something like that.
It is the highest challenge for India to meet all.
Of course, ma'am. Of course,
because giving vaccination throughout the country is the highest challenge for the governments.
Of course, because the population is very high, and though our government is doing the best to complete and reach people, we have some difficulties even for our government to implement. The most important thing is the population. Second is the educational status. Also, people also have to understand really the vaccination is really important. And also maybe because of some of the incidences, what happens made them not to come and take vaccination. I don't know. In this forum, I see so many people. We don't know how many of them are vaccinated even here.
That's true. There is a false belief and faith because we couldn't able to say or justify anything. So it depends on their person. So anyhow, we will aim for the good. So the God's grace is above all to everyone. Yes.
I also see here my colleague, Dr. Kalavalli. Very happy to see you after a long time. Hi. Very happy to see you, at least in this forum. Thank you. Thank you, ma'am, for all of your...
After a long time, we are seeing like that.
Yeah. That's true. It's really nice to see all our people, even our ma'am, because sometimes we call, but it's not like because she is always busy and things like we could not continue talking. And happy to see you all. Thank you, Dr. Vijayalakshmi, ma'am. I think she gave a very big introduction. I think it's not like that actually.
No. It is
thank
whatever
you
is there
so
in
much.
your CV, she projected. That's all. You deserve for that.
Thank you, ma'am. Thank you all. And I would like to start my session.
Yes.
By first to thank the organizers, even in this pandemic, that you have organized such a wonderful conference where people need to have some of the sort of learning as a continuous manner. That's very, very important in our profession. And as we all know that our professional people will not be able to stop. And the topic which is given is chosen for me and for other speakers, which I saw is very beautiful. Which is linking or which is related to the present pandemic.
Yes.
And always our research also we see whenever there is any issues or any concerns we see in our clinical decision making or something like that, probably we will start to think of any of the strategy initially by the nurse managers or by our people, which will make the co-workers or the nurse managers to think about the research. There, the research starts basically when we face any problems in the clinical, that is our clinical decision support is not that effective. In that case, we think of some strategies. So there we start our research. So I would like to share my screen. I think you're able to see my screen now.
Yes.
Just a minute, ma'am. I would like to make it as a full view. Yeah.
Yes.
The topic which is given for me is linking research and practice through information technology. Initially, when I was thinking, I think my mentor, Dr. C. Kanyamal, has branded me like an information technology related person. That's what I feel when I saw this topic. She was telling me, Vidya, you can think of something related to this. Actually, linking research and practice is nothing but the concept of disseminating the research. If we do research, if it has not been implemented in practice, there is no point in doing it. But how to make it to practice in an effective manner is always by disseminating the research, the findings of the research to the people or to the stakeholders or to the end users who really wants to get the benefit of it. That is what is an ultimate idea. So we focus on our topic, which is linking research and practice is through dissemination. That's what is my idea, which focused on this information technology. The contents of our presentation is about the objectives, about linking research and practice through dissemination, dissemination strategy, plan, tools. What are the tools for dissemination? Social media toolkit, tools for communication and collaboration. What are the barriers to knowledge translation or dissemination, which we focus, and the conclusion. These are the contents of our presentation. The introduction, we commonly recognize seeing, just a minute, I will just, I will minimize this so that I will be able to see my, good. It's commonly recognized that research is now actively undertaken by many healthcare professionals. You know, in this pandemic, of course, it's very, very important. Every health professional is focusing on some aspect of research, which is going to help our end users. The end users are nothing but the customers are nothing but our patients. This is clearly crucial to the underpinning of evidence-based research practice. You must be seeing that in this pandemic, we see, like, because we are just going to study about the virus now. When we started last year, we were not knowing what is the ultimate effect on the virus to every patient. So it took a long time for us to study about the virus and the ill effects of the virus on our body and things like that. So what we have to know is clearly crucial to the underpinning of evidence-based research practice. We will not be able to just implement whatever we think. We need to have an evidence-based research. The results of such labors need to be written up clearly, because initially they said this virus is going to cause a problem in a patient who's just having a respiratory infection. Then they say there is a chance of blood clots. Then they say because of this clot they die. So all these things are evidences which is being taken from the patients, from the dead bodies, or when they study about the patients after the death of the virus, which clearly makes up to understand and apply into practice. Research needs to be disseminated as widely as possible. Otherwise, research is becoming a waste, because if you do not disseminate and reach to the people, whether it is local, national, or international, there's no point in doing a research and just keeping it, you and me, just having it in our laptop or in our database. It's not going to affect. So this, if you want to connect the research into practice, we need to have a thorough dissemination process. That's very, very important. The primary purpose of a research project is to gather information about an issue or problem and construct a report or article. We need to clearly know to state or gather information about the problem. We need to know to write up the construction of a report and report, which is going to help to disseminate the findings. Okay, it must be recognized that any research activity which is done on an institutional or organizational benefits. If it's done in an institution, research-based institutions, which is for the institution or for the organization, or sometimes if we are going to disseminate to other clinicians or other nurses, which is going to help for the patients or the end users, even the public sometimes. The objectives of our topic mainly is understand the concept of linking research and practice through dissemination of research findings, appreciate the value of developing a comprehensive dissemination strategy as an integral part of a research project, understand the importance of tailored dissemination tools for various target audiences, appreciate the various information technology that helps in linking research and practice, understand the social media, which helps for disseminating the research findings. We will just see some of the tools and some of the apps, which is going to help us to have a repository of the data or to have the idea to disseminate to the people. Okay. Linking research and practice through dissemination. Research is about the generation and dissemination of findings. However, research agendas often do not match the profiles. What is more, research institutions rarely allocate sufficient resources to link research and practice. Every organization, institution would ask, do you have a publications? Have you disseminated your research article? But who is giving the sufficient resources to publish the article or to publish the findings? That's why, therefore, research findings still do not adequately inform into practice. There are a lot of studies which has a findings which is just being a repository in the library as a database in the form of the thesis, in the form of the dissertations. It's just lying there. It's not being implemented into practice. The foremost reason is insufficient allocation of researchers to help to disseminate the findings to the public or to the clinical field. Okay, the value of any knowledge product hangs on its effective dissemination. Without outreach, the efforts of knowledge workers are wasted. If you don't reach to the target audience, it's absolutely going to become a waste. So dissemination is a core responsibility of the research institutions. If my institution is going to be a research-based institution, the institution should help us or to guide me to disseminate the finding of my research into practice. How will I link my research into practice? By disseminating. When I want to disseminate this research findings, my organization should help me with the funding sources. My organization should help me to give an web-based or an online cloud where I can post or share my findings to all the people in the hospital or in the college. So this is a part where we have to start. Okay, so on ability on effectively disseminate research findings to the target audience is by the research institutions or the research individual or the person who has done a study where he or she has got the core responsibility to disseminate the finding. Okay, what are the key steps in dissemination? Are first, we need to adapt a strategic approach. We need to know the target. Who is the target audience for you? You have a target audience who is a clinician or the nurses or the healthcare professionals or sometimes the co-workers or sometimes the class 4 workers or the public, the patients. Who is the target audience for your research? First, we have to frame that. Who is my target audience? Whom I'm going to implement this? Who is the beneficiarist for this? Whether the patient is going to be benefited or the clinician is going to be benefited. That is purely based on the topic of the research. Okay, so formulate generic viable dissemination strategies, monitor and evaluate the accomplishments. Okay, now we need to know if you're going to have a plan of dissemination, we need to have a key steps for this. So identify the users, from where the source is, what is the content of yours, through how you're going to disseminate, what is the context, and who is the ultimate target audience for you. Please frame that first. Okay, identify the target audience, then only we should go for dissemination process. Then when we are going to link research into practice. Now, what is dissemination? Dissemination is a planned process that involves consideration of target audiences and settings in which research findings is disseminated. I will use my target audiences and the settings in which research findings are to be received, and where appropriate communicating and interacting with wider policy and healthcare services. See, what is dissemination? I just want to disseminate my research finding into my clinical setup in my hospital. Okay, so if I want to do in my hospital, what's my plan? It's a planned process for me to post it to the particular group where all our staff are able to see this. So identify who is your audience. Based on that, you will have a setting in which research findings could be sent or to be received. The stakeholders or the end users. This is very, very important. The stakeholders are nothing but the persons or groups that have a vested interest in a clinical decision and the evidence that supports the decision. They may be patients, caregivers, clinicians, researchers, advocacy groups, professional societies, businesses, policymakers, anyone in this, they are the stakeholders. Because if I have my study, say for example, I need to have an infection control measure in my ICU, in my intensive care unit. I have identified that this particular product is causing a chance of spread of infection inside the intensive care, inside my intensive care unit. Okay, now I have to take it to my policymakers. The policymakers only will decide what step can be taken to be implemented. Because if I just tell, or the finding of my research says that this particular product will help is in spreading the infection. No, you will not be able to do it. You have to go to the stakeholder, identify the stakeholder, and then bring it as a policy. If you need to make it with the help of the nurse managers, go to the policymakers, make it. And the ultimate, sometimes if it is just a patient, this particular patient is causing this, talk to the particular, they are the stakeholders there. Okay, so who is the end users of this? End users are the ultimate consumer of a product, especially whom the product has been designed. If I'm preparing a particular device or something which helps to prevent bed sore, in that case, the ultimate consumer is the patient who is in bedridden. They are the ultimate consumers. They are the end users. They are the one whom we are going to evaluate about our finding, whether it has been effectively used, effectively functioning or not. Okay? So the end users are nothing but the person who is going to benefit out of the finding, benefit out of your product. Linking research and practice by disseminating research findings. What do we want to disseminate? If you want to link your research, link your findings into practice, you want to implement into practice, you need to have to disseminate. Now you first make it, what do you want to disseminate first? Effective dissemination hangs on having a shared vision, common understanding of what one wishes to disseminate. Identify the target audience and map for awareness, understanding, and action. Have a successful dissemination strategies. We will have strategies according to the target audience. Then examine the knowledge product and present it as a benefit for the target audience. So first we need to know what we want to disseminate, who is the target audience, how we are going to reach the target audience, what is the strategic plan, what is the knowledge of the benefit of the particular product. This we should be clear if you want to implement research into practice. So for that, we need to have to disseminate the finding. Sorry. When do we disseminate? When do we disseminate? Make the dissemination plan realistic. Identify and set the milestones of the dissemination plan. If you have identified something new, suddenly go to the, you will not be able to go to the clinical. No, I have done the study. You can implement this to my patient. It's not possible. You need to have a set milestones. You need to have a proper dissemination plan. Okay, so this is very important if you want to connect the research into practice. What are the most effective ways of disseminating? Explore and evaluate what methods meet the needs of the target audience. What is a method I can choose to meet the target audience? If suppose I want to do for the patients, is only the healthcare health education method is okay, or I need to have a pamphlet, or I need to have a video, or I need to put it into their database. So what is your method? Identify the method to reach the target audience. It's very, very, very important. Okay. Next, who might facilitate dissemination? Who can facilitate your dissemination? Who can facilitate to link your research and link your research into practice? Existing channels to have a greater chance of success. Collaborate with others to improve the impact of decision and reduce the cost. It's very, very, very difficult for us to disseminate or to publish because the cost is very high if you want to make it to a proper journal to reach to the target audience. So we need to identify where you want to make it into practice. If it's within your institution, you make it the finding of your research study to reach to your audience first. You will have your personal online cloud, online database, online web clouds that will be there. If you want to reach the public, you have to go to social medias. If you want to reach to the other healthcare professionals throughout the world, you have to go to proper journals or conferences like that to present. So make a clear plan how you are going to facilitate your research finding into practice. If you want to implement your research finding into practice, you need to facilitate to disseminate the findings. So this is all interconnected. We'll go on to the next slide. How do you prepare a dissemination strategy? It's very simple. Strategy covers some points. First, what is dissemination we should know, the knowledge products, who is the target audience, the benefits to users. What is the benefit to the users? Make a list. What benefit if you're going to teach this to, if you're going to reach your finding to the patient, what is the patient benefit? List it out. What are the methods I can reach to implement into practice? Whether if I just call all the patients and teach only 50 patients, I'll be able to do. Or you may think initially my first step is to teach the 50 patients. Then your next step will be to reach the particular locality. Then you will think of national. Then you will think of international. So find out the target audience, find out the benefits to users, find out the dissemination methods, how broad you want to disseminate it. Based on that, you will choose the tool or the method. What are the time scale and responsibilities? See, in this pandemic, if our people want to disseminate the research findings of the clinician, research findings of the nurses, research findings of the public, even public are doing, okay? So how they are reaching to the people? See, first they will try to see their findings to reach to the within the locality. Now they want the whole world to know because it's a pandemic now. So what is the best method? You go to social media, you will get a lot of points from that. They're going for online resources, online publications, because you want to reach the people very fast, though the healthcare professionals and the public. There are some researches which is based on the target audience. The target audience only will be the public. The target audience only will be the healthcare professionals. So based on that, and find out what is your cost. This is very, very, very important. The cost is going to determine how you are going to publish your data. Monitor for the success. How do we turn our strategy into your dissemination plan? Every plan has got an objective. Find out the target audience, methods, timings, cost, and establish a clear way by linking them into 3 broad purposes of dissemination: awareness, understanding, and action. First, they should be aware of it. Then they should understand the concept, and then only it can be implemented. Okay, now research agenda requires policy, strategy, plan, and tactics. This is very, very important. For a dissemination policy, the research institutions should help. Because if you are having a study which is being conducted in your institution, the institution should help. The institution will have its own mission, how they are going to help to reach the target audience, how they have the method of dissemination of research results linked to their utilization. And I mean to tell within the organization, within the institution. What are the strategic plans the organization and the dissemination policy has got? That should be very clear. Okay, so then only you will be able to see if in my hospital, suppose some particular study has been done. I want to implement it in my hospital. Suppose the prone position improves oxygenation in COVID-19 patients. Say, we have done, say for example, in this hospital, first they will do some 30 patients they have seen. They have found that the oxygenation is very good. They will try to implement and inform all the people within the hospital. Then they will see the target audience. Oh, we need to inform the other healthcare professionals, other clinicians, and all that. So the dissemination policy, which is based on the institution organization, also will help to reach to the people in order to implement into practice. Okay, now on dissemination strategy, what is all overall effect of a research institution wishes to create? It's based on the particular issue, dissemination of research results leads to their utilization. Okay, these are some of the steps. Review past dissemination efforts, so that when we go to the review of the dissemination efforts, we will know where the pitfalls and where the pros and cons. Based on that, we will be able to refine our present strategy. Okay, determine the audience, develop messages, decide on dissemination approaches, dissemination channels, review available resources, wait for the opportunity, evaluate the efforts. Don't ever just like that post here and there. Find out which is the forum for you to present the finding of your research. That's very, very important. What is the dissemination plan? This is based upon the plans, produce a response, utilization of the response, one part of the users, based on the users. Developing a dissemination plan will facilitate the translation of your research into practice. This is very, very, very important. If you want to link research into practice, your dissemination plan will help you to facilitate the translation of your finding. Your finding is translated better by having a proper dissemination plan. There are 6 elements in this. What are the 6 elements which helps to link research into practice through dissemination? First, research findings and products. What is going to be disseminated? What is your title? What is your objective? What is your finding? Who is your target audience? End users who will apply it into practice, whether the clinicians or the healthcare professionals, or particularly the nurses, or particularly the physiotherapists. Who is the one? Okay, and who is the one who is going to apply? Who is the one who is going to benefit out of it? They are the end users. Sometimes they are the patients. Sometimes they are the healthcare professionals. Sometimes they are the public. Okay, dissemination partners. We need to have a partners. If it's an individual or an organizations or a networks through whom you are going to reach the end users. Is your finding is only for the institution? Is your finding is for the organization? Is your finding is for the public? Is your finding is for the other healthcare professionals? So you will choose the networks. What is a network you're going to choose? Communication, how you convey the research outcomes, how you are going to evaluate it. What is your plan? Because it's very important to know how you are going to communicate your finding, because the method of communication will determine the linking research into practice. The method of communication will help you to know how your finding is best utilized by the end users. Okay, what is going to be disseminated? This is very, very important. Different end users, example, policymakers, healthcare providers, may be interested in different aspects of the research. Is your finding ready for dissemination? First, you should be clear with that. Whether your study is complete, your findings are complete. Your findings are in an, in a large scale. Say, for example, your sample size should be large so that you are able to generalize your result. That is very, very important. How strong is the evidence on your research findings? Do you have your strong research findings? Do you have your strong evidence on your research findings? This is very important because this will help you to generalize your findings. This all only will allow you to practice the finding of your research. Okay, how does your research finding product conform to current procedures? Always connected to the current procedures. Okay, now find out who are the end users. End users are the individuals, patients, healthcare professionals, or delivery organizations that could benefit from the use of your findings. Find out the end products. Tailor your offerings to their needs. Tailor it, tweak the finding according to the end users. Okay, specifically, say, for example, ICU nurses. If you are going to give some of the tips of your research finding to the ICU nurses in order to control the infection rate in the ICU, they are the end users. Of course, the patient is a benefit, but still, the stakeholder here is the nurses here. So focus onto the nurses, how it is useful to them, make them to understand, okay? And make them to understand how they're going to evaluate the particular product or particular finding. Okay, nowadays, if you see the infusion pump, say, for example, if you're calculating the drug dosage, initially we used to do with the calculations. You got it? You have a calculations. Nowadays, it's not like that. You have got an app. You have got the infusion pump has got a set machines. Say, for example, you want to infuse this much ml. Just type what is the ml, what is the rate, enough. That will calculate the drop and it will implement it in case of infusion pump. So teach that particular project properly to the nurses so that you will be able to apply it effectively in the intensive care unit. What are the suggestions in order to overcome such when they have some barriers in that? If they have some difficulties in using of this type of infusion pumps. See, earlier infusion pumps is like, we will set up the drop calculation, we will do the dosage calculation, everything. Nowadays, the smart infusion pumps are there, which is having an inbuilt computer setup where you will just mention the dosage, how much you want to give for the patient over a period of time of how much. Just mention it. The infusion pump smart infusion pumps will calculate, it will deliver accordingly. Just you have to connect it. So when there is any clots, like any block or something like, usually how it alarms to you. If there is any change in the calculations or something like based on the body weight, it will alarm you. Okay, so but teach the ICU nurses, teach the target audience properly, teach the people who is going to implement or use this effectively. This is very, very important. Consider how might you develop working partnerships. This is very, very important. Who is a working partnership in dissemination of your findings? Who is a working partnership where if you're helping to disseminate your findings, how it is going to be implemented in practice? Think about opinion leaders in your professional community who might be interested in spreading the word about your research. If your research is based on specific things like in your intensive care unit, find out who is the opinion leaders for you. The leaders will be preferably the policymakers, the nurse managers in the intensive care unit. They will be the one who will be able to reach to all the nurses. Informal networks and colleagues may be useful in dissemination partners. Informal network, like you will have your group. ICU nurses in your hospital will have a group. This is your informal network. Formal networks, your hospital will have a particular health information management system software where you will post your research finding into that. That will be discussed and evaluated in the forum, which will be implemented as a policy so that the policy or the decision makers will make it as a policy to utilize this finding in the intensive care unit. Okay, so organizational dissemination partners could include quality improvement organization, professional groups of a target audience, etc. Communication, very, very important thing. The fourth step is a communication. I told you there are 6 steps in your linking research and practice. We have finished the 3. One is about this plan, about the end users, about the working with partners. The 4th is your communication. Effective dissemination relies about the publication and reports. We will just go on to the next slide, which will help you to clearly understand what is this communication is. Broadcast media. If you want to link your research into practice, if you want to make your finding effectively practiced, we need to have the communication. This is a very, very important key point, key core concept in this particular topic. Broadcast media. They are nothing but the academic journals, book chapters, technical reports, trade magazines, newspapers, like your radio or TV interviews, interest group listeners, websites. These are the broadcast media which will help you to disseminate and link your research into practice. This is the most important thing. Personal contact, academic detailing, clinical specialty associations, informal professional networks, professional conferences, meetings, workshops, CNE, participating in improvement collaboratives. These are the places. It's a personal contact because your CNE is not a big forum. It's not like your newspaper or your magazines, journals like that. It's like a small group of people will be able to understand your finding. Okay, so find out your end users could obtain information about your research findings, products through various means. Find out what method will be chosen for you to reach the target audience. The method or the tool is chosen to communicate your finding, to communicate or to implement your research into practice is based upon the target audience. The target audience only will help you to choose the method of tool or the communication method. Okay, now, this a 5th step is evaluating the success. We need to know whether the finding of my research is success or not. So I told you, Okay, like for example, prone positions in COVID-19 improves oxygenation. I want to see in the patient. Okay, because the patient are the end users of this study report. Okay, of my particular, say for example, of this research finding. So find out what is your measurable indicators, what is your criteria, how you are going to evaluate in the end users. This is very, very important. Then only you will be able to success. Whether your communication method is correct, whether there is response to your website advertisements, whether there is response to the other physicians was appreciated. They also tried there, okay, this is good. So these are the responses. Okay, this is very, very important. On effective dissemination plan is oriented to the needs of users, relies on appropriate form, languages, electronic verbal media, draws on existing resources, relationships, and networks, establishes linkages to the resources required to implement the information. We will go on the tools which is used to help linking research and practice. What are the tools? They are the research reports, peer review reports, press release, policy briefs. These are the policy briefs are nothing but the policy makers who will help us to disseminate the findings or to implement the research finding in the organization. What are the primary ways? There are 3 P's according to the research. According to the research, the linking research and practice through dissemination is by 3 P's: posters, presentations, papers. This is for professionals. Evolving dissemination tactics. You can see this this map or this what to say, like schematic representation, which helps to know how the research findings, the research report has been disseminated. You know, but it's all known to you, like your magazine, press release, etc. Your CME conferences, posters, presentations, etc. These are one of the method of dissemination tactics. Okay. Now we will go on to choosing dissemination forums for research findings to link research and practice. This is very, very important. How information technology is being used. This is what is we have come to the second part of our topic. We have finished our first part, linking research and practice through dissemination. We have come to the second part, through information technology. We need to identify that. Okay, so study site. First, the stakeholder at hospital, distribution to clinical staff, present research findings at meetings or education sessions, whether it's a conferences, through the journal or through social media or media through the newspapers, magazines, health-related papers, etc., or nursing organization. So find out which is your method to choose your design. This is based on the topic of you have done the research. The researcher, the investigator will identify what method I can choose to link my research finding into practice. My research finding into practice, say for example, if the study is related to the COVID-19 nursing education, I should reach to the organizations. Nursing education related to the students, I should reach to the students. They are my target audience. So what I will do, if it is going to be the big group of students, I preferably choose my media as a social media. Social media like Twitter, LinkedIn, Facebook, etc. This will help you to reach the big target of audience as students. Say, for example, in this pandemic, the online education related. Okay, I want to reach to my students, these nursing students, all over the institutions of Tamil Nadu, all over the institutions of India. In that case, what we will do? We will choose some social media. We will choose some of the method through the organizations. But social media, it will help you. If you have your proper hashtags properly, you will be able to reach the students very effectively. How information technology can be used linking research and practice. I told you we have come to the second part of our, the title, which is how information technology will help to link your practice. Very, very simple. It was found that information technology is relevant in facilitating effective, quick decision-making, aiding analyzing data quickly, accurately, facilitating information gathering and dissemination, enhancing monitoring of educational facilities and resources, facilitating adequate data storage, improving coordination of tasks. I will tell you, information technology is used in every step of the research. For collecting the data, for organizing the data, for analyzing the data, for making a repository of the data, and for disseminating the finding of the research through information technology. So information technology, every software has got a major role in every step in your research process. Posting research by online. The internet is now a primary vehicle for disseminating research findings. You see, open and see a social media. Everyone has got a method of doing a research related to COVID-19. They are posting into the online disseminating research findings. This internet makes it possible for all researchers to promote research online so that it has been studied by the peers, educators, students, journalists, customers for research practice, and even the general public. Everyone, whomever wants to know, to read about this COVID-19 coronavirus, they can just go to the Google on the online research. Everyone is able to study. If you are a healthcare professional, you choose your phrase accordingly, your terms accordingly. General public will choose the terms accordingly. So the most important information technology which is used to disseminate or to link research into practice is online research, online publication, online method of disseminating research findings. How we will do it? Selecting a digital format. Make the documents available in a format that can be easily opened and printed. This is very, very, very important. Successful online communications actively encourages users to read and absorb materials. You know, if you go and see the research, the evidence of the research gives an idea like most of the youngsters, present generation youngsters, do not prefer to read the concepts from the journals, from the magazines, from the textbooks, etc. The present generation, it has been proved by evidence like stating that the present generation, you are able to reach to the people to disseminate any of your concept, not only research, anything is number one by online, making it as a digital format. Nowadays, none of the students prefer to open the textbook and read. They want everything in a digitalized. They say, do we have a PDF of this? Do we have a software of this? This is what is our students' of our younger generation mentality. You want to reach to the people very fast, go to social media. You want to reach to the people very quickly, disseminating your findings. Choose your online. Choose the online method of communicating the finding, because the evidence proved that the online, the social media, the online websites will help to reach the majority of the target audience, whomever you want, whether it is a public or nursing students or stakeholders or healthcare professionals, clinicians, whomever can be, you are able to reach. Because as present research gives you that, don't go for journal, this, that, make it as an online, everything as an online, no papers. This is what is our present generation. Now, you want to make it as a database of your findings into scientific visibility. If you want to publish it, you need to have your scientific profiles, ORCID or researcher ID. It's nothing but the open research citation ID or a researcher ID. If you want to publish it, your findings to the Web of Science and Scopus, you need to have your researcher ID, so that your publications will reach to the journal, will reach to the quality or to the people whom you want to meet the target to meet the target audience. Whether it is your Google citation profiles or the Web of Science and the Scopus, you need to have your researcher ID to publish it. You know, the scientific profiles, which is identifying researchers uniquely, is a big issue for the researchers. Because if you want to publish it in all these Web of Science Scopus, you need to have a lot of money. Though you have your ORCID ID and your research ID, it's not going to be having a very, very effective way. But we need to have the funding agencies, because the publishers are in the forum is very, very costly. Now, visible research can be deposited in a repository. You know what is repository? Repository is nothing but a database which is in a digital format. It's a free online collection of documents. So suppose you go to library, you go to your library, you will have your thesis, dissertations in the form of the books, in the form of the database. This is nothing but the repository. This is the best way for you to link research into practice through the information technology. Link from your website. You can create your own site so that you will, whatever the studies you have done, you can put it into the like your Dropbox. You can put it, and you can choose to the people whomever you want to view that. Tweet. Next is tweet, blogs, speed the word, etc. Spread the word, etc. Create a profile in Google Scholar. If you want to manage your information, add new publications, manage your publications, create citation alerts. You have to go to the Google Scholar like this. You create your profile for you. If you are the one, the investigator or researcher, add new publications, whatever is there, and then you create your citation alerts. This is an app, Zotero. It's an open source resource manager. It's a free online software which helps to collect, organize, cite, and share the research. This is a free online app. You have got a video. You can just take the name of the app. You can put it in the Google and see. You have a nice video for this, how you can post it. See, for example, I have given you here. You want to choose the literature references. It's like a bibliographic data. If you want to choose related studies on this, you just type the name. It will give you the database based on the keywords and key codes. Okay, so this is one of the free online software which help to collect, organize, cite, and share the resources. Okay, Zotero. One more is there, Mendeley Research Networks. I think most of you will be knowing about it. It's a free reference manager, easy and powerful reading tool. It is also a social network which helps for collaborating options available in this Mendeley. This is also like a free online software. Okay, you can these softwares will help you to collect the data of some studies which has been done before, the repository of your related bibliographic studies, or even if you want to link your finding into this, so that the people who are the viewers, based on their phrases or the key terms, they can view your studies also. Okay, so put these words in the Google and you can see the videos very nicely in that. What are the other basic tools, okay, for your research? Okay, they are nothing but the Sherpa or the Romeo. This Sherpa is nothing but again a scientific publishing knowledge database, which will give you about the details of the publishers and the open access journals details, where you can publish it. Okay, which journal will be suitable for you for your study, like that. So it will give the details of the publishers and the policies of the particular publishers. So you will if you go to the Sherpa, you will have your own. You have to create your ID, and you will put the journal name, and it will show you what is the policy of the particular journal, etc. Next, this Digibug, Figshare. These are some of the tools. Okay, so which will help you to have the repositories. These are the repository based softwares, and about the publishers and policies tools. Then managing scientific data is by a Google Scholar, Zotero, or Mendeley, which I have told you in the previous slide. The next important information technology which helps to link research into practice is social medias. Important information technology, because evidence shows that online dissemination findings and the social media dissemination findings will reach the target audience very fast, will help you to disseminate your findings and utilize the findings of your research very fast. Okay, researchers used to promote their research, while all social media outlets have the potential for massive reach. First step is email, some form of social media. If you want to reach only to your people, you will do the first is email. There are 5 things you should consider when you are going to choose the social media for disseminating your research findings. It's choosing social media is not very easy, because social media is an open forum for you, where so many people will be able to view your findings. Number 1, your findings should be very accurate, because you should not misguide or mislead anyone by posting any information in the social medias. So what is the first step which is very important, which you have to be careful when you are going to choose the method of communication or the tool for communication of your finding is social media. First is it's important to define the purposes of using social media platforms, as well as how to use them to achieve that purpose. You should know what social media app you're going to choose, how to use them effectively. You should not try to be everywhere, or you won't be available to sustain the resources to maintain them all. There are so many platforms now, like Twitter, Facebook, LinkedIn, Medium, Instagram, etc. A lot of things are there. The list goes on like this. Choose what social media you're going to do. You can't do to social media by half measures. You need to reach a minimum critical mass and engage on a regular basis in order to make an impact. Just you put something, it's okay, it's done. You need to create an impact on this. So you need to have a continuity of your findings. You need to figure out how to combine the platforms you use and make sure that together they will earn their keep. Because some of them will see in Instagram, some of them will be commonly seeing the Facebook, some of them will see the Twitter, some of them will see the LinkedIn. So how we are going to link all this social media to reach the target audience. There are not any hard and fast rules in the social media where you concentrate your efforts, and how you use your social media platforms depends on your purpose. The resources you have at your disposal, and most of all on the social media habits of the communities you want to reach. So what is the most important thing? Make sure you've identified exactly what you want to get out of it. If you're going to choose social media, what you want to exactly do, it should be clear for you. Use your objectives as a starting point. You should have your objective if you're going to choose your social media to disseminate your findings, to link your research into practice. You need to have a proper objectives of it. Draw up a social media strategy. There are some social media strategies that identifies what platforms you're going to focus on. Whether you're going to focus on LinkedIn, Twitter, Instagram, focus only on that. How you're going to use it, what resources you need to put in place to sustain the strategy, how you're going to measure it. This is also very important. Just you have posted it, how you're going to measure whether the end users have used this effectively or not. So when you choose a social media for your research findings to disseminate, very carefully you should choose it. Go with the steps like objectives, strategy, resources, and how you're going to evaluate. You should be having it clear. What are the social networks which is commonly used to link research into practice? What information technology will help you? They are the Facebook, LinkedIn, a social networking media. I think most of you will be knowing this one. If you have a similar interest and backgrounds, the people with similar interest and backgrounds will be following you in the Facebook, Twitter, and Instagram. They are the three most popular examples of a social media network website. Number 2 is bookmarking sites. What is bookmarking sites? The examples are the apps like Pinterest, Flipboard, Dix. Bookmarking sites allow users to save and organize links to any number of online resources and websites. This Pinterest, Flipboard, and Dix, if you have to create your ID and you open your bookmark sites, you will be able to connect the studies which is in online, which is related to your topic. You can connect all those things to this, like having how you keep your bookmark in your textbook. Same like that, you will be able to do here bookmarking sites. A great feature of these sites is the ability of users to tag links. You're able to tag the link, a link of similar studies. Okay, the similar studies of all the links will be having your bookmarks here. That's what they are, nothing but the apps like Pinterest, Flipboards, Dix, etc. Okay. Next, social news examples is Dig. This is purely for social news. So if your study concept is based on the social news, what you want to do it, so you can see here, they are nothing but the Dig. In US, mostly the social news will be put in the Dig, in this Dig app, which will help you to post the news links, other items to external articles, etc. A good example of social news site is the Reddit. Reddit is one of the app. Reddit app. They are the social news app. I think some of you will be knowing about this Reddit app. Next is media sharing. Examples again, the Pinterest, YouTube, and Vimeo. Media sharing websites allow users to share not only the online links, but also the video, sharing the images, etc. Okay. So if your particular study has got your video to be linked here, you can use the media sharing like your YouTube's. You will create your YouTube channel on your own, okay, and link it here. Okay, Pinterest and Vimeo, etc. Next, microblogging. Microblogging, you all know about this Twitter and Facebook. They are just what they sound like sites. They allow the users to submit their short written entities. If my study finding helps to improve the oxygenation or reduce the infection rate of COVID-19, I will post something here. The Twitter and Facebook, so that so many of the persons who is having a similar interest will be able to visualize on this. What are the 10 tips for tweeting research to have an impact? The first step is don't be afraid to promote your own work. This is what we always fail our people. Our people will do a lot of research and very good findings, but they are afraid to promote on your own. If I put on a social media, someone is going to question me. Don't have such fear if you're confident with your research finding and evidence good. Have a clear sense of purpose for why you are on Twitter. I will tell you very specifically, if you're going to choose a social media, you should be very clear. Why did you choose a social media? Why did you choose a Twitter? Why did you choose the YouTube? Okay. Why did you choose the Pinterest? You should be very clear. You have a clear sense of it. What is the purpose of choosing that particular app for you? If you're going to tweet about something controversial, there are some other controversial things related research are there. How you're going to link those things? There are studies which is related like this, but my research finding is not like this. Is a controversial things. How you're going to do it? Plan it out well. Tap it into your community. The more you post, the more the followers you will attract in the social media. The more the followers you have, the broader the audience will be there. Use the hashtags wisely. Put the terms very clearly, which will help you to link or connect most of the studies which is related to the particular key term. Okay, the hashtags to be put wisely when you're choosing the social media. Take a cue from young researchers, because young researchers always now gives the good key terms which will be disseminated in the online journals or online websites like that, or in the social medias. Because as I've told you in my session very clearly, the youngsters, if you want to reach the target people, this is the best method to reach. Okay, this is an evidence. Take control of your research group's updates. Familiarize yourself within the social media guidelines. You should be very familiar with the guidelines of social media if you are going to choose a social media to disseminate your findings. What are the possibilities and pitfalls when you choose a social media like this? Rapid and easy dissemination of research. Of course, you can reach the audience very rapidly. Critical review of existing articles and raw data sets will be there. Possibilities for raising funds for research. If you want to raise the funds for research, you can use social media. Publicity of researchers or institutes will be there. Networking between clinicians, researchers, and patient groups will be very good in social media. Big data analytics for prediction models and assessing trends. What are the pitfalls? Lack of peer review and filtering the quality. The quality will be in a question, because social media, everyone will feel whatever they have. That should not be there. Fake news spreads fast. Difficult to refute. Misinterpretation of research will be there. Dissemination of pseudoscience through social media. That's why I say professionals should be very prompt in knowing the guidelines of social media. Should know very clearly why did you choose this particular social media for your disseminating research. What are the tools for collaboration and communication? I will give you a beautiful example. If you want to collaborate and communicate the research finding of yours in the institution or the organization, the best method is Dropbox. I want to communicate to my colleagues in my college, in my hospital, in my nurse manager level, in my educators level. in my institution. So I have some 30 or 40 people here. I will use the Dropbox. That's the best method to reach to all my nurse educators. Google Drive. This is your first method of sharing in your online cloud storage. Second, storage, web platforms for collecting the notes, pictures, video clips. If you're going to do in your hospital some video clips for, say, for example, the dental or any artificial prosthesis which has been used before, after, you want to have some pictures, video clips, etc. You can't put it in every mobile, every device here and there, because that becomes illegal, because confidentiality of the patient, confidentiality of maintaining the records within the hospital is very important. That's why even if you want to take any video or clippings about the particular patient, legally we are not supposed to use our personal mobile. We have to use a mobile which is in the hospital, because that particular mobile or the camera which is used for your video clips or the pictures will not be sent out of the hospital without the authority, without knowing to the policymakers, without knowing to the higher levels of stakeholders. Useful on mobile devices like Evernote. Evernote is again a cloud storage, which is a free app which is found in a smartphone. What is very important in this is a tool for gathering information and keeping it all in an organized manner. In research, this Evernote will help you to gather the information and keeping it in an organized manner. Okay, this is just open and see the HTTPs of evernote.com. You will have this free app which can be downloaded into your smartphone, so that everyone can have the say, for example, even in our classroom teaching, we can use this Evernote. So it's also a good method for teaching and learning between the students and the educators also. So this can be used as one of the tools in the research, so that you will be able to gather all the information and keep it in an organized manner. The next is your Padlet.com. It's an online group note wall for participants to post text, images, and links. If I have my research findings to be put in my hospital, in my college, I can use this Padlet.com, because this online software will be kept for all my colleagues here, so that we can collaborate and discuss about the common informations which can be which need to be shared or discussed. Next is Pirate Pad. Pirate Pad are nothing but the online notepads. Pirate Pad again, Padlet or the Pirate Pad is again a free online tool which helps for a common things which is used for teaching and learning, and also in the research. Okay, now as per the policy of an organization or institutions, if the research finding to be disseminated to the hospital, within the hospital, usually every hospital will have an hospital management software system. You will be knowing it, because in every hospital there is nowadays in a computers they have a software, MogDoc, Insta. These are the softwares. Okay, MogDoc, Insta, Attune, IT-DOS Info System, Suvarna Health Information System, Kaizen Health Management System. These are the softwares which is commonly used in the hospitals. Any software, any one software. Some hospitals prefer to use the MogDoc. Some hospitals prefer Kaizen, because I was familiar with this Kaizen Health Management System, which we when we worked in our hospital. What is the importance of this hospital management software system will help in linking research and practice is a question now. See, there are two things which will happen in the hospital. Like for this Kaizen, say for example, health management system will have a lot of icons in that. When you open the particular software, like your laptop, you will see for the staff it will have separate, for the lab it will be separate, for the inpatient, outpatient, MRI, scans, investigations, then what, pharmacy. Like every department will have an opening into this software. So if the pharmacists want to do something, they will open the pharmacy part in this software. There are so many icons on that which is related to the pharmacy. Like that, for nursing, we have one of the icon here in this case, and health management system. Number one, it will help you to detect or know about the errors in the hospital. Errors done by nurses in the hospital. Say, for example, wrong administration of medication. Okay, and infection. This is all based on the quality indicators of the JCI. The quality indicators of JCI will be put in the hospital based on the ICU, based on the ward. In intensive care unit, we have got some quality indicators like the infection rate in the ICU, ventilator-based associated pneumonia, then what else? Then there are some key indicators. Okay, if it is in surgical unit, there are some key indicators like surgical site infection, infection rate in the surgical site. So these are some of the things like that. You have got the medication errors or something like that. But in case, and there is one more option like in that is they have got an icon here as research. So based on all these things, what we see are errors, quality indicators, infection rate in the ICU, hospital-acquired highs, hospital-acquired infection. Based on that, the policymakers always will try to have some of the strategies, some of the research plans, okay, and some of the research findings that will be put through the health management system. So we, the nurses in the intensive care unit, nurses in the hospital, will open this particular forum. We will be able to know what research is being done in the hospital, what is the finding in that research. So this is reaching or dissemination of research finding or link research into practice within the organization. Okay, there are some organizations which will, the nurses, if you ask, say for example, I'm just telling because our profession, any studies going on, we don't know. It should not be like that. You can open some of the health management systems like this. It should be posted there. There is some particular study is going on in this particular ward, in this particular ICU. This is a study. This is the objective. It's going on. So you will have a curiosity to update your knowledge. What is the finding of it? You will check the policies in that. There is another option. There is a policy whether this can be implemented or not. So there will be a policy in that. Like every nurse should be aware. Now you are going to follow that this particular protocol is being common for all patients in the ICU who is in bedridden. So there will be some changes. Okay, that should be there. So the hospital management system software also is a very good information technology to disseminate the findings, to utilize the research findings into practice within the organization. This is only within the organization. No one else can see your finding within the organization. What is the benefits of this linking research into practice? Improving patient care, initiating the change, finding it out, search the meaning of it, need to understand, specialist the area of interest, testing the theories. For organizational, the benefit for linking research into practice is improving healthcare and well-being, planning for change and innovation, informing policy and practice, knowledge-based approach, encouraging an evaluative culture. There is something like a blameless culture. I think you must be listening in the some terms in the hospital. We should always have a blameless culture. What is this blameless culture? Again, is there is some error happened in the hospital. We should not tell that this is a nurse or given the wrong medication. This is blameless. This culture is not good. Accept the error has happened. Do not blame like she is like that. She has done this wrong. Don't blame it. Accept it so that the next time it will not happen again. Developing evidence-based practice, reacting to a public opinion. These are the benefits. There are some barriers to knowledge translation or dissemination. Yes, we have some barriers. The first important thing is challenge to introduce and sustain evidence-informed protocols. So it's a challenging for all the persons, all the investigators, okay, to give an evidence-informed protocols in the context of competing priorities in healthcare. Lack of continuing education and unsupportive organizational culture. If the organizational culture is not very supportive, you will not be able to disseminate your findings. You will not be able to utilize and implement the finding of your research. Any attempt to improve the quality of care for patients by translating research must incorporate a clear understanding of the associated barriers. We need to know the clear understanding of the barriers. Then only you will have, you can rectify that. You can have a behavioral change. The low skills. This is very, very important barrier. The low skills. The perceived cost, the information overload. You know very well the perceived cost. The cost is very high if you want to publish your finding into your research findings. Because if you do not publish your findings, how it will be implemented? It's a question mark. To conclude, what are the 10 steps of innovative method of linking research and practice through information technologies? First, get the basic rights. Define your objectives, map your audience, who is the target audience, plan it well. 2, keep the right profile. Use your personal websites, social media accounts, researcher identifiers, ORCID, researcher ID if you want to do it in your Web of Science corpus. So keep the right profile with you. Without that, don't try to disseminate, don't try to link your research into practice through information technology. Is not possible. Encourage participation. In the age of open science, don't just broadcast, go for multiple, multi-directional dissemination. Don't only choose only one method. Only I have done in the conference, only I have done in the newspaper, only I have done in the journal. It's not like that. Go for multi-dimensional dissemination. Open science for impact. This is your 4th step. 5th, remix traditional outputs. Give traditional outputs like research articles, books, impact boost with accompanying by summaries, press release, blogs, visual video abstracts, etc. Don't try only on online. Use your traditional method of dissemination to link research into practice through the through the journals or something like that. Go live. There are certain things which you have your live conferences, presentations, but only live should not be there. Okay, in person, some studies we need to have your live person dissemination. Does not just have to be stuffy conferences. Hit the road and take part in your science festivals. Give talks, then road shows. Like that you choose. Don't choose only the conference. Only conference you should not choose. Choose the different methods of life. Think visual. Because disseminate findings in the multimedia interpersonals. If you are thinking something with visual, it will have a good impact. Respect diversity. Research should reach to all. My benefit, respect, inclusion, scientific dissemination, etc. Choose the right tool. What tool you are going to use to disseminate, to communicate. If you want to communicate your linking research and practice, what is the tool you are going to choose? What is the format? Whether you are going to go for online tools, online apps, social medias, or if it is within the organization like your health management systems, choose the tool properly and always know how you're going to evaluate. What is a right impact to evaluate, right method of evaluating, and because the right method will give you a good impact. It's very, very, very important. So these are the 10 innovative methods of linking research and practice through information technology. These are the references where you can open up and this particular sites which will give you the idea on linking research and practice through the information technology. Thank you. I think I have I have finished it based on the requirements because I did not see. I'm sorry, I did not see your chats here because it was fully on my screen. Okay. Thank you, ma'am.
No comment on this. So they appreciated that it's a very good informative session. Nothing else. Like the chat box I have seen. Excellent presentation.
Thank you so much, ma'am.
People have given feedback, and it is somewhat like what we can. It's a bitter god like for nursing. Nursing always we used to be at the bedside and having that. What we used to be there technology fear.
Yeah.
People used to have. But we are outbreaking, so I'm really very proud to have the youngsters to come up. And I found out Vidya when I was there in Meenakshi and in Ramachandra as a student. I just notified some of your talent, and as a teacher and as a PhD scholar at Meenakshi. So I know your potential. That's why I have given this topic for you. And I think I believe the audience also have given a feedback. I am very happy to note that because you have given the justice for that. Really, you took a lot of homework for this. To even I made you to read some more on in this aspect. I believe.
Sure, ma'am. Because of this, I could find out some of the apps which is related for our research also.
Yeah.
But I'm very happy, ma'am. Nowadays, it's not like before. Our youngsters are very, very good in the information technology.
Yeah.
Information technology, because we see our students very nicely. They are using the information technology.
That is true.
In the bedside. In the bedside also.
So even I would like to place a mark over here. Our tutors, 3 members, they are efficient in handling all the technical component.
Excellent.
So Deepika, Jelaine, and Vijay Daniel. So these people are our technical team now. It's a strength.
I'm happy to hear Vijay Daniel, ma'am. He was my master's student.
And again, he was also our master students, and then UG also he did in Meenakshi.
Yes, in Meenakshi.
UG, our UG, PG he did in
PG there. Yeah. He was my student in UG when I was taking UG for him.
He was the UG student, and then PG at MGR College, AC College of Nursing. So, in Chennai only. Yes. So I'm happy. So the people are very strong in this technical. So we are also promoting them, giving opportunity for them, and then they are also giving side support for all of our endeavors of technical ground, online, even admissions, and for that any of activities, conference, virtual mode, everything they are only taking up challenges, and few other teachers are also joining to along with them. They are learning. Even though they are senior assistant or associate professors, are also now they are emerging in the learning phase. But these youngsters are very, very talented in this area.
Yes,
and that we have to learn. So we have to learn. Even I too ask my son to learn for something. You teach, mommy, more better what you are teaching us, like that. He said nothing so, but we need to have a lot of in-depth learning in this area as per the nursing concept. So really, it's a thought-provoking, and it is a learning session for every one of us. So really, all the nursing fraternities, either the student or the faculty whoever attended this virtual mode of international conference, it gives a lot of input, and then provoking ideas, and know about things, and remove the fear for the barriers of IT technology. And we too also incorporate in our nursing as a syllabus itself. Then it will be good. We have to, I don't know, the new syllabus of INC, it may be incorporated this element also. Probably it may come, we don't know when it comes. So we can even propose that. So to the Nursing Council, so that it will be good idea, because still more awareness in this area is required now. Without technology, no one can escape.
I would like to highlight a point here, ma'am, because we in our masters we did one of the unit as nursing informatics.
Yeah,
I remember.
There,
but we have a separate. But we hear in other countries they have a separate course.
Yeah,
the subject nursing informatics. They are preparing their students to update the knowledge and information technology, so they are able to handle better in the clinical. Because I remember, because I was also a part of teaching this nursing informatics subject course. Initially, I found it really difficult because there are a lot of apps, things like that, which is being used in the clinical, which we have to incorporate and teach in our theory. But when we studied, it was in the masters, is only one unit. Because I went and told my head here, because I was telling my head here, because I said, Doc, it's very difficult for me because this is not a course for us. This is only a unit for us in our masters.
Yeah, that's true.
But he was having a confidence on me, like he was telling, no problem, you can do. I have confidence on you, like how our ma'am says. He also told the same thing. He said, though the course is new, I think you will be able to do better. But the outcome was very good. Because we have a student feedback evaluation. Based on the student feedback evaluation only, your next SEM topic will be, our course will be given. They will consider the student evaluation. So they have mentioned very clearly, we are very happy with this particular teacher, though the course was very new for us. But I think in future, maybe in our curriculum also, if they create a course like this, it's good for our students to shine better when they come out.
Yes, we have to try for that. Or if not, we at the university level, we can, whether we can have an additional course we can have. So
value-added courses. Like your value-added courses. You can have some value-added courses on informatics.
That feeling, it came to me, at this moment, I got into my mind. So I can propose for our university, I think. So because we have a lot of information technology people over here, we can utilize to have additional value-added course we can able to bring into the university. It's a very good thought-provoking idea. So now this time it may trigger my mind. So I have to take some.
I will help you to get that syllabus of it, ma'am. Curriculum of this.
Thank you so much. And
sure. I will share the curriculum.
I can disseminate to our university. They are the most welcome people. So the university will support us to take any of some new added advantage courses for our students also. We will do it. We will do it. So I'll get you in touch for that.
Sure. Thank you so much, ma'am. Thank you so much for giving me the opportunity to.
Even in other country, you are you are proving my belief. So I'm very, very happy for that.
Thank you so much.
Thank you, Vidya. You deserve for that. Wish you good
Thank
luck.
you all. Thank you all, ma'am.
Thank you, ma'am. Yes.
Dr. Vidya, it was an accelerating presentation. You beautifully led the presentation, linking research through research and practice through dissemination. I thank Madam for the words of appreciation. You really deserve for that. The concept starting with key steps, dissemination plan, end users, communication, evaluating success, dissemination tools. You made it very clear. It was very simple and clear to, I believe, to the audience. And choosing dissemination forums for research findings, posting research online, databases and scientific visibility, managing scientific information. All were very useful and highly informative for all of us. You made very clear all the key concepts discussed. Lively and highly informative session. Thank you, Dr. Vidya, for sharing your expertise.
Thank you, ma'am. Thank you all.
Thank you.
Welcome, ma'am. Thank you all. Bye, ma'am.
Thank you, ma'am, for sharing your deep knowledge. I thank Vijayalakshmi, ma'am, for sharing the session. Now, we will have the next presentation by Mr. Vidobha Narayan Malkar, Faculty of Mental Health Nursing, Institute of Psychiatry and Human Behavior, India. The topic is a reason behind our vibrating smiles for healthy lifestyle. I would like to invite Professor Akila Devi, SRM College of Nursing, to introduce the speaker.
Thank you, Shiva. Good morning to one and all. I am here happy to introduce an emotional intelligence trainer, a life coach, a motivational speaker, a team leader, Mr. Vidobha Narayan Malkar, Assistant Professor in Psychiatric Nursing from Institute of Psychiatry and Human Behavior, Bambolium, Goa. His professional qualification is he passed GNM in the year 2001 with distinction from Institute of Nursing Education, Goa. Completed BSc Nursing in the year 2009 with a distinction from KLES, Belgaum. And also completed Masters in 2013 with distinction from MCon Manipal University. And also he completed MPhil in Mental Health Nursing in the year 2015 with distinction from MCon Manipal University, and he is currently pursuing PhD from Bharati Vidyapeeth, Pune. To add to his qualification, he has done Masters of Hospital Administration and Diploma in Hospital Administration. To add to his experience, he had 10 years of clinical experience in Goa Medical College, in neurology, ICC emergency unit, more than 6 years of teaching experience as lecturer at Institute of Nursing Education. And he has handling subjects like research, mental health nursing, advanced nursing practice, foundation, etc. And he also teach PG students and currently is an assistant professor in the Institute of Psychiatry and Human Behavior, Bambolium, Goa, and he has more than 10 years of experience in the field of enhancing emotional intelligence among adolescents, teachers, nurses, managers, and also other youths. And he had, to add to his experience, he had published and presented many papers and also published in national and international journals. And he is expert in the faculty development programs, in leadership building seminars, and enhancing emotional intelligence. Sir, I welcome you, sir, to present on the topic as a reason behind our vibrating smiles for healthy lifestyle. Thank you, sir.
Good morning to you all. Am I audible?
Yes, sir.
Thank you, ma'am, for that wonderful intro. Thanks for the organizer for inviting me for this second international conference on nursing science and healthcare. I'm indebted for that invitation and overwhelmed to present on this topic, which is quite diverting from all the very important topics which were taken since morning by two stalwarts. I'm adding to that and I'm sharing my screen.
Sir, you can click that. Okay. Sir.
Yeah. Is it visible?
Yes, sir.
Yeah. So once again, a very good morning to you all. And the topic which has been given to me is like the reason behind our vibrating smiles for healthy lifestyle. And in this current torrid times and testing times, I think it is a very relevant topic that has been given to me. And I hope I'll be doing justice in this half an hour talking on the same topic. So when we talk about our smile, smile is happiness you'll find right under your nose. Absolutely. Isn't it? We don't have to search smile or happiness anywhere else. It is right under our nose. It is right in our hand. So are we practicing it or are we following it? Are we smiling? Are we happy? Is the question that has to be asked. Now, why this smile thing becomes relevant in our life as well as in this testing time? Because no matter how much engrossed we are or how much the testing are the times, what can bring us out from that is the smile on our face. Whichever country it may be, there are delegates from different countries, there are attendees from different countries, but what we can assure is like our smile can heal everything. Our smile can bring on that happiness around us. Our smile can be so contagious that we can light up an environment. And fortunately, we are in a profession where we are working with humans and not machines. And when we say that, what we have to be what we have to wear always is a smile. And how to wear this smile? Everybody is wearing this smile. Some frown, but then they understand like what is the importance of smile. Why it is important for our healthy lifestyle as well as to the lifestyle of people whom we are caring. Now, why we are talking more about this smile and all during this torrid times is one thing because of the catastrophic event that has happened, COVID-19, and the world has been engrossed with it. The world has been engulfed with it. And in this current scenario, we are being overworked. All the frontline warriors, all the people caring for the sick are all tired. They are burned out. And in this scenario, what happens? The smile vanishes. And when this smile vanishes, what happens is like the healing process gets slower. Now, when this healing process gets slower, the morbidity and mortality increases. So it is all interrelated, whatever is happening. So a very healthy mindset or a happy mindset can always produce 10 other happy or healthy mindset. So that is the importance of smile for us. And when this catastrophic turn into a pandemic, every nook and corner it has reached in the whole world, everybody is suffering from the same dilemma. Everybody is suffering from the same mystery. When will this end? and we can't see the end in the foresight. What we are doing is like we are helplessly working towards it. We are helplessly trying. We are positive enough. We are trying our level best to bring out a vaccine, to give preventive treatment, to give remedial treatment. All these things are done. Now, all these things, when they are done, if as mental health care personnel, we wear a confident smile, the output will really be different. The output will really be a productive one. There's no second thought about it. Now, what are some of the effects that have come on happiness because of this pandemic? If you see, like, there have been a lot of interpersonal disputes that have been happening. We were thinking like there is lockdown, people coming together, there will be a lot of harmony. But what has happened is like, as news reports have come, as articles have come, as things have been reported, there has been a lot of disharmony in houses. So the smile has vanished. Why this is happening? Because of some faulty communication, because of the emotional hijacking that is taking place. Whatever is happening is like the interpersonal disputes are coming. At workplace also, because of burnouts, many disputes are coming. And what the end product of it, the byproduct of it, or the result of this is the vanishing of the smile. Financial crisis, we have seen a lot of burden, especially in our country. We have seen like just because people are coming from middle and lower middle class families, what has happened is like suddenly their source of income has gone out. And what has happened is like the tension, the anxiety of how to bring up the family, how to take care of the children, all these things are coming in the mind of people. Social withdrawal, human beings were called as social animal. Now suddenly what has happened is like there is a full stop. They are saying like, if you want to survive, better don't come together. And this change which has come is, it was unexpected for us 1 year back. Now we are gradually getting accustomed to it. But because of that also, what has happened is like our social gathering has vanished. The interaction has vanished. Technology is helping us, but the resultant factor is like the vanishing of the smile. Sleeplessness. The people who are attending this conference, they only will tell how it has affected, how it has taken toll on our sleeping pattern. Suicidal ideations, various people, various reports have come, like people have gone so down in their life, they have decided to end their lives, and lack of basic facilities. These all things are contributing to one thing, that is unhappiness. And unhappiness means frowning. Unhappiness means anger. Unhappiness means getting irritated. Unhappiness means getting depressed, and unhappiness means losing that beautiful smile. So what can we do? What can we do? Our role is multiple. Our role is as a human being, as a family member, as a societal person, and primarily as a mental health care personnel. So all these roles, when we take up together, the onus is on us, that how we will project ourselves. How we will project ourselves to others so that others get influence from us and they get positive and they get the right things in their life. So it's a beautiful but a difficult responsibility. And I'm damn sure that many of us, most of us, are shouldering this responsibility in a very good way. And some of them might be struggling, but this particular presentation might help you to build up that smile on your face and go forward with a vibrating smile and bring out a change in healthcare of people and yourself. Why the onus is on us? Because we are the backbone of healthcare industry. Nursing and other healthcare personnel, nursing per se is the backbone. If doctors are considered as the brain, we are the backbone. And the head can be held high, or the brain can be held high only when the backbone is erect. So what I basically understand is like, we have to be positive about ourselves. We are overburdened, I know. We are overworked, I know. But we have to work on the philosophy that these too shall pass, and we will overcome that. And that broad smile which we have to bring on our face, which will bring out good positive output for ourselves also, and the people we are caring also. Because as a patient, the patient might be looking up to us, like, because he's in a dilemma as to what is happening. And when you are knowledgeable about things, when you understand things, you can put in a much better way with that therapeutic smile on your face, which will bring the remedial action. And this works because, as they say, like a positive output and a smiling introduction reduces half of the sickness of the client. And when this is said, why shouldn't we practice it? We should definitely practice that. So how can we handle this? Overall, whenever I do a presentation, I always say like we should enhance our emotional intelligence. And when we say like when we have to enhance our emotional intelligence, that means we have to take control of our emotions. Now, what are the emotions? All the emotions like anger, being disgusted, being distressed, being unhappy, and smile is also an emotion. And smile is the vital emotion of our life. So we should be in control of our emotion. We should be in control of our smile. That's where life will be going in a straight way. Otherwise, there will be a lot of hazards, because when we have lost our smile on our face, we cannot direct other people to be happy, to be smiling, to be working to their potential. Why? Because you are not doing that. Self-awareness is the most important thing. It will get clarity in your life. When you know that you have to be happy, when you know that you can be contagious in giving that happiness, and negativity also is contagious, then the onus is on us, and we are the vital part of the healthcare system. So what we have to do is that we have to give that smile to others, and we can definitely give. Now, why smile often? Let us understand what are the importance. Actually, there are scientific importance, scientific intricacies of smiling. It's not just like me presenting this and telling you just smile. No, it is actually vital. It is actually scientifically proven. There is evidence enough to say that we should be smiling. We should bring out this emotion quite often. First and the foremost reason is it is because of the release of
Okay. Thank you, Pa. Thank you. Thank you, Pa. Yes. Over the presentation.
Sir, disconnected now. I'll connect again. I'll connect.
Okay.
Then shall I go for videos?
Yes, ma'am, sir is there. Sir is there. He's listening. Sir? Vitopa, sir?
There is internet issue.
Ma'am, no, sir connected, ma'am. He's listening. I think we have some other issues.
Okay.
Ma'am, shall I play videos, ma'am? Will
Yeah.
Ma'am, video podung, ma'am. Vitoba, sir?
Sir?
So you can start, sir.
Yes, Jalil.
Sir?
Sir has joined through.
Yes, ma'am. I have changed to ghost also.
Yes, yes.
Sir, unmute yourself, sir. Unmute yourself, sir. Yes, sir. You can talk.
Yes, sir. Thank you, sir.
I'm really sorry for the interruption. I deeply regret it. I think suddenly the network went. Sorry for that. Yeah. So what I was saying is like body should be smiling quite often. Then what I was talking about is like endorphin. Endorphin is the happy hormone. And when it is released, what happens is like it is released throughout our body, and what we feel is like the happiness, the goodness in us, and that goodness we can transform into other. That is the scientific base which is there. Secondly, it is needed for our healthy lungs. Whenever we laugh, we expand our lung and we stretch the muscle and we create a homeostasis or balance. So it's like an exercise. And when we are in these COVID times, when we tell the patients also that your lungs are getting affected, we should be doing exercises and all. Smiling can be a good exercise. Having a laughter club can be a good idea. So what happens is like when we do this smiling, what happens is like we are actually utilizing our lungs in that process. And when we are utilizing our lungs also stay healthy, and it is replenishing the oxygen in our lungs also. So it has dual benefits. So what we have to do is like when we smile, we have to tell this medical benefit also to our clients and to our near and dear ones. That is the second scientific base, which is very important. Third and very important, facial exercise. When we frown, what happens is like our muscles shrink, isn't it? So what we can usually do is like a good laughter or a good smile can release that muscles, can make that muscle flexible, and we can have that brightness, that glow on our face. That is the third scientific base, which says we should have a vibrant smile. Then the trust factor. When we communicate, what happens is like our trust is built on when we maintain that eye-to-eye contact, when we have that smile. When we go to the clinics also, we understand the patient has a relatedness on us. The patient can relate very well with us when we have this broad smile and wish them. Then they feel the trust factor. Then they feel to be taken care of. And when the trust factor is built, the care, the turnover or the output is a little bit faster. It is always said that all the outputs, all the relationship in our life should be based on trust. And when the T is removed, everything rusts. So to build that trust, a smile is very, and a genuine smile. It's not a fake smile. Why? Because when you have a genuine smile, the warmth can be felt from that side. And when the warmth is felt from that side, what will happen is like the other person will mimic that smile. And when the other person mimics that smile, there is this synchronization that happens. So trust factor is built when you have smile on your face. Next is positivity. As I said, positivity as well as negativity, both are contagious. And I would say like negativity is 10 times more contagious than positivity. And in this scenario, when all the environment is becoming negative, wearing a smile confidently and giving our care will always bring and help us to give care without any nuisance, without any harm being happening. So when we can pass this positivity through smile, why we should be holding us back? We shouldn't be doing that. We should be showing a smile to pass on this positive. The world needs positive people. The world needs smiling people. And so what we have to do is like, we have to carry on that baton. We have to carry on that baton of positivity with a flashing smile as healthcare person. Productivity. See, just understand a day when you're frowny, where you don't want to do anything. You had a very bad argument at home and you come in the office and you sit without showing a line of smile. What happens is like the other person realizes that your day is not good, and what they also prevent from communication. And what happens is like you find any solution for that, your day also goes on dull, and the productivity, whatever work you had to do for that particular day, is also not done. And when this scenario in COVID times where our output has to be 110%, we always should be smiling. Why? Because that will increase our productivity. That will increase our output. That will make us very efficient professionals. And that is the need of the hour. Beauty. This I should not be telling you all. When we smile, we say like, no matter what your complexion is, no matter what your caste, creed, religion is, what we have to do is like, we have to flash that smile, because smile doesn't have any religion. Smile doesn't have any caste. Smile doesn't have any regionality. Smile doesn't have any country. Smile is universal. And when smile is universal, everybody should flash it. That is my humble request to you. To distress. Why we have to smile often? To distress ourselves. Why? Because once endorphins are released, the stress hormone cortisol reduces, and you will notice that unpleasant feelings quickly melting away. That's exactly precisely what is happening in form of neuropeptides in our body. Just not because I'm telling that endorphin work. No, it is scientific base. These are the neuropeptides which have the ripple effect in our body. If we have positive vibes, the positive ripple effect will be created. So the onus on us. It is up to us like what type of effect we want to create in our body and outside our body in the surroundings. Longevity. Now, this might be debatable. Some people might say like, I want a short span of life, but it should be a healthy life. But what is proven is like, actually smiling adds 7 years to your lifespan. So even if you have kept a benchmark of 60, you can count 7. You can add 7 to that and make it 67 by flashing that smile. Only investment that you have over here is smiling. Only investment is that smiling and putting the pain away. Smiling and finding solution. Smiling and being a problem solver. Smiling and being a motivator. Smiling and being a good leader. smiling being a good stress buster. So this is the responsibility on us. And it all starts with simple thing, that is a smile. No health issues. As we say, like a smiling person is always healthy. It doesn't mean that you will not have any sickness. But even if you have sickness, if you have that attitude of smiling and caring and confident, what will happen is that you will come out of that very easily. Because when you smile and all, what happens, your heart rate normalizes. Your stress comes down. What happens is like if you are not getting sleep, if you're having insomnia, that anxiety goes on. So what happens, basically you can be relaxed at your mind, relaxed at your heart. That means you will be having healthy physical, all your organs as well as physiological function. So that's why health issues will be minimal when you flash that smile. Less pain. Now how less pain? Because it acts as a natural painkiller. So smile acts as a natural painkiller. You might be going through grief. You might be going through different stages of grief. But what I can assure you is like once you analyze the things and put a smile on that, you will find solutions also for that. You will overcome that problem also, and you will have a healthy and happy life. That's how things have been overcome with a smile. Whenever debacles happen, whenever disaster happened, people have fought those disasters with a broad smile, with that confidence. So endorphins act as natural painkillers. So whenever you smile often, what will happen is like whatever pain you have, that will be relieved and you will be healthy and hearty. Youthfulness. Who doesn't want youthfulness, isn't it? Like when we always feel like we should be young at heart, we should be young in our body, we should be exercise for that, we work out for that. One simple exercise what I would recommend to you all is smile. Staying happy. Rather than crying on what is not there, celebrating what is there. Crying on that person is not doing the right thing, celebrating the nine good qualities that the person will be having. Because nobody is perfect. If we were perfect, we would have been demigods. But what we can do is like we can be near perfect. And smile is one asset that we can utilize to go towards this youthfulness. Next point is immunity. When you smile, it definitely makes you relaxed and lets your immune system react quickly and effectively to disease. You just see like you take two patients. One patient is there very much apprehensive about the things, what will happen, he's hypertensive, but he's around the clock thinking about that and he's tense about that. And the other person is like, yes, I have got hypertension, but the medication is started and I'm having a good support system. He's realizing that and both are being given the same treatment. You will find that the person who was happy or person who was smiling and taking it confidently will come out of the sickness in a very fast manner. So that means what? That means the stress or the immune system which was there in our body is acting out very well because you are at peace. When you are at peace, all the system will work in a very good way. So always remember to have that hearty smile. Healthy heart. Smiling frequently keeps your heart healthy, making it beat at a regular pace. It keeps blood pressure in check too. So it is like a natural antihypertensive which you are taking. When you are smiling, it keeps your blood pressure normal. It keeps your heartbeat normal. It keeps you at peace. Then what more than that we can expect from a natural remedy like smile. So healthy heart. Next point is like whenever you're smiling, be approachable. You just remember, you just recollect your study days or student time days. Now also you can recollect whom you can approach very easily and whom you can approach with caution. And the only difference will be like that person is always frowning. That person is always on a serious mode. The other person is bubbly and smiling. So even if any problem is there, I can tell that person. I can approach that person. I can find solution in that with that person. So when we spread smile, we spread positivity. A lot of people will come to you for solutions also, and we will become a problem solver too. Next point is attractiveness. Yes, when you smile, no matter how costly dress you wore or a simple dress you have worn, or a minimal dress you have worn, or an Adivasi for that matter, or anybody, or a farmer in the field, if he has a flashing smile, nothing can beat that. When he smiles, the smile reflects back on you and you compliment that and you also feel at ease. So attractiveness. And attractiveness doesn't mean only with beauty. No, attractiveness to your whole persona. No matter from which religion you are, no matter from which caste you are, no matter from which country you are. Next point is confidence. Yes, when you smile, you instantly look more confident and at ease. Yes, this can be seen. The fact that you're smiling or laughing or having a giggle, that means you are confident about yourself. You are having a good day. You are enjoying your life. You are actually analyzing things in a correct manner. And people also get attracted towards that, and they reflect that back, saying that, okay, if that person can be smiling, even if he's having so many problems, I can also do that. So it actually builds confidence in you as well as in confidence of other people. Smile is contagious. So we are bothered about COVID being contagious. We are getting infected by COVID. We should take this precaution, social distancing, masking ourselves. We should be taking the medication. We should keeping ourselves aloof. All these things we are discussing. But one thing we are forgetting is like there is another thing in our life also, which is called a smile, which is also contagious. So when we are giving care, when we are interacting with fellow human beings, when we are interacting with family members, let us give that smile to other people. Let us contribute in giving a positivity to our other people. Why? Because there is a lot of negativity that is surrounding. So as I said, as mental health personnel, the onus is completely on us. The way we will project ourselves, the better will be outcome totally in the healthcare scenario. So when this is contagious, let us pass on this. Rather than thinking of getting infected by COVID, let us get infected by something called a smile. Let us make this contagious. Let us pass on this to many people as we can. Let us be on a mission to pass on smile. And it is an ultimate stimulator. Ultimate stimulator, I mean, smiling stimulates our brain's rewards mechanism in a way that even chocolate, a well-regarded pleasure inducer, cannot match. We always thought like giving a chocolate brings happiness in other person. But scientific evidence shows that more than the chocolate also, even if you have a broad smile and if you embrace somebody with that smile, that can be the best possible stimulator. And that bring out the best possible output in that other person. An employer, when he comes and flashes that smile and wishes and gives the target to people in a happy manner, that day it will be the best possible outputs. Other reward system like bonus and all are working, but what I'm saying is like this reward system is free of cost. This reward system can be used day in and day out, and this reward system has 100% remedy back, 100% result back. So we can always utilize this ultimate stimulator, that is smiling. So how to go about it? How to flash this smile? How to carry on this baton of spreading smile across nation, across countries? For that, what we need to do is like we need to know something called as mood meter. Now, what is this mood meter? Mood meter is how are you feeling? Now, whenever you get up in the morning, what we have to ask ourselves is like, how am I feeling today? And I request you all to apply this in your life. It is very effective. If you see these quadrants which are there, the red quadrant will be showing different emotions. The yellow quadrant will be showing different emotions. The blue quadrant will be showing different emotion. The green quadrant will be showing different emotion. So when you ask this question to yourself, you know in which quadrant you fall. You fall, okay, I'm feeling frightened today, and I'm also feeling timid today or bored today. Is this the right emotion that I'm having? No, I should be carrying the emotion of happiness. So what happens is like you try to convert yourself in the other quadrant, like being lively, being joyful, being smiling, being relaxed, being tranquil, being restful. So what we have to do is like, even if now you are in this red or blue quadrant, if we try, we can very well go in the other quadrants, that is yellow and green. So whenever we get up henceforth in the morning, when we ask ourselves, how am I feeling? Yes, I'm feeling today cheerful, and I'm feeling today a lot more relaxed. I can smile and start my work. That is the feeling you'll get, and that is how you will proceed, and that will how you start a day, and the day will always be beautiful. I'm not saying there will be disaster, there will not be disaster or bad times, but what I'm saying, when you are asking yourself question through the mood meter, you instantly get answer where I'm falling and what I should be doing here now. That answer you'll be getting. And we have to try that. We have to try that, and then definitely fall in the yellow and green. Next thing to infuse smile in us is something which I will propose today, which is called as psychological vaccination. we were all the stalwarts and the delegates and the speakers were talking about getting vaccinated, and then the different people having different mindset and all. Today, as mental health care personnel, I'm emphasizing on something called as let us focus on giving that psychological vaccination. By a smile, giving a smile, and then telling people that this smile is also a very good vaccine towards all these problems which are there, which may be psychological, but they are affecting your physiological functioning also. So what do? You get vaccinated first. You get vaccinated towards motivation, get vaccinated towards distressing yourself, get vaccinated towards getting moral understanding, get vaccinated towards getting optimistic. These are the psychological vaccinations which are needed. And smile is the icing on the cake. Smile is the best possible vaccine that we can give. It is a booster that can remain for a lifelong. We just have to transmit. We just have to give it. It is available free of cost. Crores of money on this vaccine. This vaccination which we are having with us, psychological vaccination, it is available free of cost. Only thing, we hesitate to give it. Don't hesitate. Let's give it. And when we give it, it will multiply. There was this beautiful incident which I always narrate. There was a priest which was giving a sermon in the church, and he told all the people who have gathered in the church that the balloons in the corner of the church. What you do is like you take one balloon, inflate that balloon, and throw in that open hall which is there. Everybody ran, inflated that balloon, and he said, write your name also on that. So everybody wrote their name on that balloon and threw it in the hall. Then the priest said, Father said, okay, my dear children, what you all can do is like go and get your respective balloon. Everybody ran and started searching for their own balloon. In that process, they were stamping on other people's balloon also, and they were bursting it off. The father noted that, and father said, wait. What you all can do is like lift the balloon, see whose name is there, call out that person's name and give it to that respective person. And when they started doing this, within few seconds, all the balloons reach to the respective people. What is the moral of this story? The moral of the story is that smile as a vaccination, when we will give it to others, it will reflect back to us. Happiness, when we will give it to others, it will reflect back to us. So it is like give and take. It is like karma. It will come in a cycle towards us. So our actions, when we speak through our smile, the smile as a contagious product will reach to n number of people, and that same smile will be reflected back to us. So we are responsible for our happiness, and we are responsible for other people's happiness too. So let us get psychologically vaccinated. And to maintain this smile throughout our life, in our day-to-day life, today let me give you a healthy mind platter. When we will follow this healthy mind platter, what will happen is like one thing, we will be at peace. One thing will always be cheerful. One thing will be always be smiling. And when we are smiling, the surrounding around us will be cheerful. What does that mean? So that means like we should have something called as timing. We should have our time. We should have some time to meditate, some time to relax, some time to ponder on things. That time we have to. Everybody has been given 24 hours. But what we can do is like we can always have our time. Then we should have our downtime. Downtime means a relaxing time where you introspect on things to be done. That you have to maintain. Playtime, whatever. See, since all the lockdown has come, restrictions have come, that doesn't stop us from having a small plays at home or something, or relaxing games. We should always have that. Connecting time, very, very important is connecting time. Just because we have been socially isolated doesn't mean we should lock in a room and just be on Netflix or doing something. No, we have to be connected with people. So make your web, make your small group. You can have your professional group, you can have your personal group, you can have your specific group, you can have your dance class group, you can have a singing class group. Many groups can be made. Make these groups, because this will multiply or amplify your happiness which is there. So smiles will be amplified. Focus time. Now, what is this focus time? Focus time is when you have this objective in your mind and you do on that, you act on that objective. So it might be working also, 9 to 5 working or something, that working time. Physical time is you go for a walk or you go for swimming, any activity that you are doing that will keep you fit. Okay, that you can do. And having a very important is having a very nice sleep of 6 to 8 hours. Now, because of the duty hours, because of the active schedule, it might not be possible. But we can always re-channelize ourselves and maintain this platter. I'm not saying everybody will follow everything on this platter, but this healthy mind platter, even if you have maximum things out of this, that will definitely help you. Help you in doing what? helping you in being pleasant, helping you in being building up that smile, helping you being vibrant, and helping you in having a healthy lifestyle. We frown, we usually we search reason to be unhappy, we search reason to get petrified, we search reason as to say like this thing will not happen. This is learned helplessness that we have. Once a failure, twice a failure, thrice a failure, we feel that we are a failure. But we have to cultivate that optimism, and that optimism will come only when we have a broad smile, only when we follow on the mood meter, only when we follow on the healthy mind platter, and these things will definitely come unto you. We as human beings, we always consider ourselves as superior being on this earth. And now we're having this menace also. So when we are considering ourselves superior being, I'm quite sure that we can overcome this menace also. And to overcome this menace, a vibrant smile is the need of the hour. And I wish and hope everybody over here will flash that vibrant smile, will have that vibrant smile, and create that positivity around them, wherever they are working, wherever they are living, and create a healthy planet on the whole. To conclude, smile is that emotions which signifies the essence of true living and healthy lifestyle on the whole. With our smile, we will be healthy, and we can cure hundreds of needy clients around us. Let us together transmit smile and conquer this testing time. From all these emojis, what we have to do is like we have to come to the emoji with the yellow hair person that is smiling and giving a broad smile. And my question to you all is finally like, even if this person can do it, this creature can do it, why shouldn't we be doing it? Why shouldn't we be reluctant in doing it? Why shouldn't we be having a guarded approach doing it? Let us come together and spread smiles. I wish and hope all those people who are watching this and those who are not watching also, you all stay safe, take care of yourself, give that splashing smile to the people around you, give a healthy output, and let us hope that this too shall pass sooner. Okay, and we'll come out victorious. Thank you very much. And once again, I regret for the each that came in between and there was a disconnection. I really regret for that. I'm sorry. Please take my apology. Thank you very much for giving me this opportunity. Thanks a lot. Any question I would like to take? Thank you very much.
Thank you, sir, for taking your valuable time to present in this international forum beautifully regarding the smile and its importance. It was very interesting, and everyone will take your message. It was exactly what we needed today. What we have to know and practice in our life. Thank you, sir.
Thank you very much.
Thank you, sir, for sharing your expertise on smile and psychological vaccination in this session. Thank you, Akila, for sharing this session.
Thank you. Thank you so much. Yeah, stay safe.
So the smiling is not only for this COVID, for normal life, sir, excellent presentation. And now this time the smiling is a bit difficult because all sad moments and could share because of the COVID. So that only, but all the rest of the time, any other thing that we can able to. Now the prediction of the condition and sufferings for the near and dear relatives and friend circle, people are getting more often, instead of smiling, only fear exists in everyone's face. So that is the one. But anyhow,
that's where our role is very important, ma'am. Our role becomes
simplified. Yeah, that is true. That is true. That is true. And all other physical importance and then time plans and other thing, everything we have to do it. In turn, at least we have to make ourselves to become smile. So due to that, that smiling a bit difficult to during this era because but now the socialization is de-linked, and then a lot of people are suffering. So that hearing that news, even the smile also resists to come. So that
we are procrastinating also. We have to take one day at a time.
Yeah, that is the one. But on anyhow, we have to balance everything. Yeah, that's one. Yeah, it's good. It's good. Always good. Smiling, it relaxes all type of our emotions and everything. Resilience will be developed. Everything is good. In that focus in a healthcare forum, we have to balance everything, whatever it happened. but the general public also, the little bit knowing is only the tough. So knowing entire thing is also not possible now, because no one knows that. And many people in and around all the publics, they are having a lot of fear and not knowing much about the value of wearing mask or keeping distance. And all these lockdown, everything, the general public, they are not following, and they are also leading the problems to others. So that's the one, they take it very easy. So some group of people taking too much of fear within that. So the everywhere the fear is there, but we have to balance. As being healthcare professionals, we need to know how to balance the activities and smile and everything. It is the part and parcel of the life. Thank you, sir.
Yes, thank you so much, ma'am. Thank you for giving me this opportunity.
Yeah.
Take care. Stay safe.
Yeah, for you also, sir. All of you also be safe. Take care of health.
Thank you, ma'am. Now we will have the last speaker of this conference, Samak Hanwar Mohammed Salabi, Associate Professor, Fundamentals of Nursing, Alexandria University, Egypt, on the topic, A Holistic Approach to Caring with Compassion. This presentation will be video presentation. Now I invite Professor Kalavali to introduce the speaker.
Good morning to everyone. I am happy to introduce expert Dr. Samha Anwar Mohammed Chalabi, Associate Professor in Critical Care and Emergency Nursing at Alexandria University, Egypt. Madam stepped into nursing as a Bachelor of Nursing student in the year 1995 at Alexandria University. She completed her Master in Critical Care and Emergency Nursing in the year 2000 in the same university. Also, she received doctorate at Alexandria University in the year 2011. Madam has got totally 23 years of experience since 1997. Madam has held various positions during her professional life at different universities like Sultan Qaboos University at Oman, King Saudi bin Abdul Aziz University for Health at Saudi Arabia, and Alexandria University at Egypt. Madam had more than 20 publications in the Scopus and Index Journal. Madam has contributed more to the nursing profession as a nurse educator, researcher, and also the administrator. Madam received award for the certificate of best presentation for Cardio Alex conference in the year 2003. Also, she received certificate of master degree in critical care nursing with grade excellent in the year 2004. Madam served for nursing profession, being a member in the different association like National League for Nurses, Women Nursing Association and Medical Specialty Board, and European Pathway Association. We are privileged to have Dr. Samha Anwar Madam as a resource person in this international forum. Since Madam is not able to join with us due to network issues, she sent her video presentation on a holistic approach to caring with compassion. Now I request our technical team to share Madam video recorded video for the delegates.
Good day, respected colleagues, conference organizing committee, and all conference participants. It's a great privilege for me, Dr. Sameh Anwar Chalabi, Assistant Professor, Critical Care and Emergency Nursing, Faculty of Nursing, Alexandria University, Egypt, to share with you and today my talk regarding a holistic approach to care with compassion. Also, I need to convey my message and my deepest appreciation to all nurses all over the world who are currently fighting and struggling against COVID-19 pandemic. Nurses
have a crucial role in providing direct, individualized, holistic care to meet the biopsychosocial and the spiritual needs of their patients as well as their families or significant others via the integration of caring and caring process during nursing care provision. That's why caring can be viewed as the disciplinary foundation for nursing as well as human science, based on Watson theory 2009. As you see here, in this holistic model, it's an integration of biopsychosocial as well as a spiritual model to meet the patient's need over these four domains, which is in line with Watson ordering of human needs, which over 3 levels. The lower order needs biophysical include needs for food and fluid elimination as well as ventilation. Then the lower order needs psychophysical needs, including the activity and the inactivity as well as sexuality. And the higher order needs psychosocial, including the needs for achievement, affiliation, interpersonal needs, and finally self-actualization, which is in line and in harmony with Maslow needs hierarchy. That's why Watson articulated 10 curative factors which conceptually and practically illustrate caring behaviors, and that encompasses formation of humanistic altruistic system of value, installation of faith and hope, cultivation of sensitivity to oneself and to the others, development of helping trust relationship, promotion and acceptance of expression of positive and as well as negative feelings, use of scientific problem solving decision making, promotion of interpersonal teaching learning, provision for supportive, protective, as well as corrective mental, physical, social culture, and spiritual environment, assistance with gratifications of human needs, and allowance for existential and phenomenological forces. As you see here, the 10 character factors narrowed into 7 domains: humanism, faith and hope and sensitivity, helping and trust, expression of positive and negative feelings, teaching and learning, supportive, protective, corrective environment, human needs assistance, and finally, existential, phenomenological, spiritual forces. Regarding to the formation of humanistic altruistic system values, which begins developmentally at early stage of values and shared with the parents, mediated through one's life experience and learning one gains and exposures to humanities, and it is perceived as necessary to the nurse's own maturation, which then promotes the altruistic behavior towards others. In relation to the faith and hope, which is essential to both curative and curative process, when modern science has nothing further to offer to the person, the nurse can continue to use faith and hope to provide a sense of well-being through beliefs that are meaningful to individual patients. Cultivation of sensitivity to oneself and to the others, explore the need of the nurse to begin to feel an emotion as it presents itself, develop one's own feelings. It is needed to interact genuinely and sensitively with others, striving to become sensitive and make the nurse an authentic, which is encouraging the self-growth and self-actualization in both the nurses and those with whom the nurse are interact with. The nurse promote health and higher level functioning only when they form person-to-person or nurse-patient's relationship, establishing a helping trust relationship, which is a strong tool in the mode of communication, which establish rapid and caring characteristic needed to in the helping trust relationship, including congruence, empathy, and warmth. Communication includes verbal, nonverbal, listening in manner which convey empathetic understanding and empathetic attitude. Expression of both positive and negative feelings. Feelings alter thoughts and behaviors, and they need to be considered and allowed for in a caring relationship. Also, awareness of the feelings helps to understand the behavior it engenders. Use of scientific problem solving for decision making. The scientific problem-solving method is the only method that allows for control and the prediction and that permits self-correction. Also, the science of caring should not be always neutral and objective. Promotion of interpersonal teaching and learning. The caring nurse must focus on learning a process as much as teaching a process, understanding the person prediction of this and perception of the situation, assist the nurse to prepare a proper cognitive plan. Provision of for a supportive, protective, corrective, mental, physical, cultural, and spiritual environment. Boston divides those into internal and external variable, which the nurse manipulates in order to provide support and protect for the person's mental and physical well-being. The external and internal environment are interdependent. The nurse must provide comfort, privacy, as well as safety as a part of these curative factors. Assistance with the gratifications of human needs. It is based on hierarchy of needs similar to that of the Maslow hierarchy. Each need is equal and equally important for quality nursing care and for promotion of optimal health. All needs deserve to be attended and be valued. Allowance for existential phenomenological forces. Phenomenology is a way of understanding people from the way the things appear to them, from their frame of reference. Existential psychology is the study of human science using phenomenological analysis. So, factors help the nurse to recoil and mediate the incongruity of viewing personal holistically, while at the same time attending hierarchical ordering of needs. The nurse assists the person to find the strength or courage to confront life or death. Despite the lack of universal definition for caring, it is known that it consists of two major elements. The instrumental caring behaviors, which consist of technically and physical behaviors of care, and the expressive caring behaviors, which including the psychosocial and the emotional behavior. Caring also has described as the moral ideal of nursing and the heart of nursing. Moreover, care is a major intellectual, theoretical, and core central to practice of nursing and nursing profession. That's why nurses all over the world are confronted by many challenges and barriers during care provision to their patients, including limited caring time due to work overload or insufficient or over nurse-patient ratio, stressful working environment for patients as well as family, altered or impaired communication skills among some nurses, overwhelmed nurses with advanced technology. Many times the nurses emphasize and focus and pay much attention regarding the machines and advanced technology and the devices, and completely forgetting about their patients and real care provision to their patients. In addition, some cultural diversity in many countries all over the world. Furthermore, patient's diagnosis itself can be a barrier against care provision, especially during the current COVID-19 pandemic. Sometimes the diagnosis itself can be a huge barrier. The type of the health institution, the age of the nurse, the experience of the nurse, the level of education of the nurse, also the nurse's self-respect and beliefs, and finally the workplace circumstances or environmental factors.
Is the video over?
No, ma'am. Still more 15 minutes more.
Regarding to the work environment, as you found here, it can include the time allocated for each nurse to provide direct care, the nurse satisfaction with their salary, the nurse's feeling of being a valuable member in the healthcare team, the quality of relationship with the manager or the healthcare team leader, the demand of the patients or the system, the inflexibility of the work routine and the protocols, the sense of job security, behaviors of other colleagues in the same word or in the same working environment. We can name it peer pressure, comfort and accessible and organized ward design or the working environment, assignment method by the nurse managers, lack of human resources, lack of material resources, lack of regulations that clearly describe the duties of the nurses, and finally, priority given to provide patients' basic service needs. Regarding the workload and job satisfaction of the nurses, it can include workload and lack of enough time, extra workload, or higher nurse-patients ratio, interest in nursing provision, job satisfaction, self-respect and respect to nursing provision, attitude to caring in doing rather than communicating with the patients or client, and finally, lack of motivation to be involved in the care. All these factors can be considered as a great hinder against improving the caring approach of the nurses. Finally, the nurse's educational background, which includes the theoretical educational during the nursing course, if they receive a previous course regarding care and caring behaviors, and inadequacy of the clinical training and behavior and use of the instructors during undergraduate education. Regarding to the patient's characteristic, many factors can interfere with the nurse's ability to provide care for their patients, including the patient's age, gender, attitude and expectations of the patients, cultural as well as educational differences, medical diagnosis of the patients, the stability of the hemodynamic status of the patients, either patients stable or not stable. It can be a very great factor which interfere with the patient nurse's ability to provide care for their patients. And finally, the patient's level of consciousness.
That's why many initiatives and strategies must be directed toward improving nurse-patients communication and relationship over the three domains: the affect domain and the behavioral domain, and finally the engagement domain or action domain. That can be conducted by encourage the nurses to establish different caring strategies and how to show their emotions and direct their emotions with their patients, how to direct their behaviors and caring behaviors toward their patients, as well as their actions. The nurses can use the words, their thoughts, their feelings, looks, actions, movement, gestures, body language, touch, act, and also providing direct procedures and as well as health education and information is one of the successful strategy. Regarding the affective domain of caring, when establishing the nurse-patient relationship, it can be influenced or interfered by common confusion between these terminology: sympathy, empathy, and compassion. That's why all nurses must be aware with the exact meaning of each one of these terminology. Sympathy is the feeling of pity or sorrow, which is a completely subjective feeling without any action or any step forward. Then empathy will be the capability of understanding the ideas, the experience, the feelings expressed by the patient or another person, and then creating a therapeutic relationship according this understanding by putting yourself in the position of that person and then interact accordingly. So empathy will be the ability to understand. If you are transformed the empathy into action, this is the compassion. So the compassion will be a virtuous response that seek to address suffering and needs of the person through relational understanding and action. So in a simple way, empathy, sympathy, and compassion. Sympathy means petty-based, lack of understanding. It's an obligatory response or spontaneous response, is an emotional reaction and full of subjectivity. Not push the nurse forward to an action to support their patients. While empathy is including acknowledgement, objective feelings, understanding, isomorphic state, as well as cognitive perspective. You have to understand your patients, put yourself in the position of the patients and act accordingly. If you are transform the empathy into an action to help your patients, to support your patients, will be the compassion.
which is a virtuous response, non-conditional, altruistic, and action-based. When comparing the sympathy with empathy, we can find that empathy allows us as a nurses to treat our patients with compassion and fostering strong relationships that are mutually beneficial for the patients as well as the nurse. Also, it requires listening, kindness, and time taken to truly understand the whole patients and their life. Also, it enables our patients to feel supported and understood during some of the most stressful period during their life while they are hospitalized or in the hospital. That's why nurses' empathetic behaviors or attitudes conveying a caring message to their patients and subsequently improving the patient's outcome over increasing the physical and mental well-being, remove the tension or minimize the tension of the patients, recognitions of the patient's emotion response, increase the harmony and cooperation among the healthcare team members, increase the patient satisfaction, reduction of the care errors, anxiety and patient dissatisfaction, and improve the patient's hospital stay experience. Regarding the behavior and the engagement domain of caring, these are examples of caring behaviors as perceived by the nurses as well as by the patients, including attentively listening to the patients, giving instructions or teaching to the patients, treating the patients as an individual, spending the time with the patients, touching the patients to communicate caring, being helpful for the patients, giving the patients information, showing respect for the patients, supporting the patients, calling the patients by his or her name, preferred name, being honest with the patients, trusting the patients, being empathetic or identifying with the patients, helping the patients grow, making the patients physically and or emotionally comfortable, being sensitive to the patients, being patient or tireless with the patients, helping the patients, knowing how to administer infusions, being confident, using soft and gentle voice, demonstrating, watching over the patients, managing equipment skillfully, being cheerful with the patients, allowing the patients to express the feeling, including the patients in planning of care, treating the patients' information confidentially, providing reassurance, presence, returning to the patients voluntarily, talking with the patients, encourage the patients to call if there are problems, meeting the patients' stated and unstated needed, responding quickly to the patient's call, appreciating the patients as a human being, helping to reduce the patient's pain, showing concern for the patients, giving the patient's medication on time, paying special attention, relieving the patient's symptoms, putting the patients as a first priority, and giving good physical care. As you found here, many examples, and you can find during your real life and during your real care provision for your real patients many other different examples for conveying a caring behavior, conveying caring engagement of your patients in direct care provision. It can be concluded that caring is the essence of nursing. Caring can be effectively demonstrated and practiced interpersonally. Caring consists of curative factors which result in satisfaction of certain human needs. Effective caring promotes health and individuals or family growth. Caring responses accept person not only as he or she is now, but as what he or she may become. Caring environment is the one that offers the development potential while allowing the person to choose the best action for himself or herself at a given point in time. Caring is more healthogenic than curing. A science of caring is complementary to science of curing. Finally, practice caring is central and essential for nursing as a profession. And thank you.
Is over?
Yes.
Yes, ma'am.
Very good video covering of caring. Yes.
So really, the presentation was more informative with significant points. Really, it will be more helpful for all of us to deliver compassion nursing care for the patients with holistic approach. Also, thanks a lot for taking additional effort for preparing and sending the video presentation, ma'am. Thank you, ma'am. And also, I thank our Dean, ma'am, for giving me the opportunity to introduce the resource persons. Thank you, ma'am. I also thank Shiba, ma'am, for inviting me for the same. Thank you, ma'am.
Okay, thank you.
you, ma'am.
What about that following sessions, ma?
Next, we will be moving on to the scientific paper presentation, ma'am. I
Yes.
request all the presenters as well as the participants to enter into the breakup rooms allotted for you in the agenda. I kindly request Jelin to brief on this.
Thank you, ma'am. Soon I have opened the breakout rooms. So presenters and evaluators can join in the breakout rooms. So it'll be asking you options over the down join room. So you can click that and you can join any rooms you want. Or if you're facing any issues, we will be allotting. Just put a message in the chat box and we'll be allotting.
After the kind announcement, after the scientific presentation, all the participants as well as the presenters are requested to join in the common room. We are going to have the valedictory program.
So evaluators and presenters, please join in your respective rooms. So others, whoever is there, I'll help you to join. If it is difficult to join in a breakout room, please put a message in a chat box. We'll be guiding you. Don't worry, ma'am. I'm just allotting you. So I'm doing every work. I'm just assisting all.
Yeah, but that will be better, I think. Since the last yesterday you have done
Yes,
same way, you too also can do. That will be saving time.
Yes, ma'am. Ma'am, which group I have to assign you, ma'am?
For me?
Yes, ma'am.
So yes, yesterday I was there in Mother Teresa. Now maybe Dorothea or Florence, whichever. It's okay. Anything.
Dorothea Pudama, ma'am.
Okay.
Okay, ma'am. Thank you.
Yes, ma'am. Thank you.
So other faculties who were there, please join breakout room because I have assigned everyone now. Please join breakout room. Ma'am.
Miss Ramya ma'am is in Dorothy, but she should be inside the Mother
Ma'am,
Teresa. She's the evaluator. She's
அவங்களே
the
navigate பண்ணிக்கலாம் மேம் அவங்களே navigate பண்ணலாம் அந்த ஆப்ஷன் தான் போட்டிருக்கோம் மேம் பிகாஸ் ஏன்னா லேட் ஆகுதுனால மேம் எல்லாரையும் இது பண்ண சொன்னாங்க அதனால எல்லாருமே மாத்தி மாத்தி போட்டிருக்கேன் மேம் அவங்க எந்த ரூம்ல இருக்காங்க ரம்யா மேம்
she entered, Jaren. She entered.
ஓகே 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 மேம் யாராவது கேட்டாங்கன்னா அவங்களே நேவிகேட் பண்ணிக்கலாம்னு சொல்லுங்க எந்த ரூமுக்கு வேணாலும் போலாம் மேம் So participants here, please join in the breakout room. So we don't have any sessions over the main session. So you can join in a breakout rooms.
We all are keeping them in main room.
Quit, don't quit. Noodles, don't noodles. You are too concerned with what was and what will be. There's a saying, yesterday is history. Tomorrow is a mystery, but today is a gift. That is why it is called the present.
Real life's a little bit more complicated than a slogan on a bumper sticker. Real life is messy. We all have limitations. We all make mistakes, which means, hey, glass half full, we all have a lot in common. And the more we try to understand one another, the more exceptional each of us will be.
Not everyone can become a great artist, but a great artist can come from anywhere.
Life gets you down, you know what you gotta do?
I don't want to know what you gotta do.
Just keep swimming, just keep swimming, just keep swimming, swimming, swimming. What do? We swim, swim.
Your story may not have such a happy beginning, but that doesn't make you who you are. It is the rest of your story. So, who are you, Panda?
Maybe it can, if you are willing to guide it, to nurture it, to believe in it.
But how? How? I need your help, Master.
No, You just need to believe. Promise me, Shifu. Promise me you will believe.
I will try.
Good.
Ow! Jeez, what was that for? It doesn't matter. It's in the past. Yeah, but it still hurts. Oh, yes, the past can hurt. But the way I see it, you can either run from it or learn from it. Ah! You see? So what are you going to do?
First, I'm gonna take your stick.
No, not a stick!
There is no secret ingredient. It's just you.
But we have to try. So no matter what type of animal you are, from the biggest elephant to our first fox, I implore you, try. Try to make the world a better place. Look inside yourself and recognize that change starts with you. It starts with me. It starts with all of us.
I'm Dr. Zoidberg. Hooray for Dr. Zoidberg. Huh? There you go.
skies ahead, yes, I'm on my way. And there's nowhere else that I'd rather be. Oh, tell everybody I'm on my way. And I'm loving every step I take.
shall we start the next session, ma'am? Ma'am, mute king, ma'am, unmute பண்ணுங்க.
Yes, we'll do it fast, within 10-15 minutes. Yeah.
Shiba, ma'am.
Yes. The time has come. Ma'am, shall I start, ma'am?
Yes, ma'am.
The time has come to draw a curtain to our program as we come to the close of it. A very good afternoon and a very warm welcome to all of you to this valedictory session of International Conference on Nursing Science and Healthcare. To start the program, we are happy to have with us Jessila Mustafa, Scientific Research Analyst, Bioleagues Worldwide, who has always shown keen interest in all our activities. May I kindly request ma'am to deliver welcome address.
Ma'am. Thank you, Shiva. Yes, good afternoon to all. With this, we come to the end of the second International Conference on Nursing Science and Healthcare, organized by Society for Nursing Practice and Bioleagues Worldwide and co-organized by SRM College of Nursing from Chennai. This was an amazing two-day scientific event where nursing professionals from across the globe came together on this virtual platform to share their expertise and recent advancement in nursing science. SFNP and Bioleagues take immense pleasure and pride in joining hands with SRM Nursing College to organize the second ICNSH 2021. Even though the pandemic stopped us from joining together for a physical conference, with Dr. Kanyamal and her entire college's support, we were able to conduct this two-day event. Thank you, ma'am. I was very much impressed to see your faculty and students' coordination throughout this two-day event. I would also like to thank all our dignitaries and participants who has contributed to this event and was part of this memorable day. We are happy that all the presenters have given an exemplary presentation, and congratulations to all in advance. And I'm sure it was a tough job for our session chairs and evaluators to come to a conclusion. So without any delay, I request Dr. Kanyamal ma'am to do the honors, the Dean of SRM College of Nursing and the Organizing Secretary of second ICNSH 2021.
Yes.
Thank you, ma'am.
Thank you, madam. Yeah.
The sails of this particular notion were adjusted by a person who is not only a great motivation to all of us, but a visionary and the person who gave us the belief to bring together this event. May I take the pleasure of requesting a respected Dean, SRM College of Nursing and Organizing Secretary of ICNSH to deliver to present the International Conference report and to announce the Best Paper Award. Ma'am, please.
Thank you for the opportunity. It's a very good afternoon to one and all. So it is my pleasure and privilege to take this job. It's a tough job of a report preparation. So all this credit goes to my faculty and all the supporters behind the screen. So I'm thanking each and every one of you to get ready with a brief report about the 2 days international virtual conference. So I'm thanking first that Society for Nursing Practice with the Bioleague lead along with our SRM College of Nursing, SRM IST. So it is immense pleasure on behalf of all the College of Nursing faculty, student and our university. I'm thanking the Society for Nursing Practice and again the Bioleague. So very good opportunities to have interlink collaboration with you. In future also we need to have collaborations, do such events even on campus. Our university is very, they are very much helpful in extending help for all the way. But due to the COVID, we are fortunate or unfortunate, I don't know. Anyhow, we connected with virtual. So the 2 days program, it went on well. As per my concern, a brief report about the any function or anything end with a good report. So that is my job. As a co-organizing secretary, I used to lead for the day of valediction. The day one. So the conference theme, connecting, collaborating, concluding, and nursing care and healthcare. So the second virtual international conference on this theme, it has been conducted for 2 days. That is 21/5 and 22/5 of May of this year. And now day one report, it goes by we started the session by 8:30, by 9 o'clock. A good beginning makes a good ending. Keeping this in mind, the virtual international conference began by 8:30 a.m. The participants started to join through virtual mode. Different institution, hospital, and organization were registered earlier, and they joined in time. So really, I congratulate all the audience, and even now, we are almost around 150 audience participants in this. So we are thankful for all the audience for their entire cooperation. Between 9 and 9:50 a.m., Dr. L. Gopichandran, he has presented the topic on accelerating the evolution of the whole evidence approach to promote health. So the section was very well innovative and then motivating for all the healthcare domain people. And between 9:50 to 10:30 a.m., again the second scientific presenter, Dhanabalan Anbulakshmi Anbuselvi, Dhanabalan Anbuselvi has presented from Singapore, presented a topic on transforming the research through innovation, connections, and collaboration. So she spoke very clearly about all the COVID-19 pandemic as being an infection control nurse manager. She has given a vivid presentation on this. And following that, Dr. Emiliano Ayan Susan from Normal University Philippines, between 10:30 to 11:15 a.m., he has presented a very well eye-opening session on efforts to improve coordination care. Between 11:15 to 11:40, we had that inaugural session. During that session, the virtual lamplighting has been arranged by our technical team, Jeline, scientific research analysis, and Bioleague worldwide welcomed the gathering. Madam Jessila Mustafa has welcomed the gathering. Myself, Dr. C. Kanyamal, Dean College of Nursing, SRM IST, gave a special address. And following that, Professor Lieutenant Colonel Dr. Ravi Kumar, Pro Vice Chancellor of Medical and Health Sciences, has inaugurated the 2 days international conference, and he has appreciated all that Society for Nursing Practice, and as well the Bioleague, and in cooperation with our SRM Nursing College. He very well highlighted the importance and significance of nursing research and implementation into practice. So that session ends by 11:40 to 12:45. So myself, as a scientific presenter, I have presented on models of connecting research and practice as a part of magnet journey. And this topic also, it has become very much eye-opening for all our nursing fraternity. The magnet journey is the need of the hour. It is expected for maintaining a quality health service, and all the participants also have been comment on this, send a WhatsApp message to me also. I'm so much delighted on this. And 12:45 and 2, between 2. So Dr. Revati Principal Velamal School and College of Nursing has delivered a lecture on healthy healthcare system and healthy nation, and she focused all that policy making state and national level, how to coordinate with the healthcare team. And again, following that, the audience break for lunch for half an hour. And between 2:30 and 6:15, we had a scientific paper presentation. So, almost around 70, total 67 papers. So these papers are divided into 4 breakdown rooms. Under that, they have divided into groups, and totally they presented 67 papers. So then each hall, around 15 to 16, 17, like that, we have divided. And this day 2, from morning 8:30 to today, so 22nd of May, we had a session of between morning session 8:30 and 9. Dr. Rita Lakshmi, she has presented a topic on emerging and re-emerging infectious diseases. Her name, Dr. Rita Lakshmi, principal from D.Y. Patel. And following that, 9:40 to 11, so Dr. Vidya from Saudi Arabia, she has spoken the linking of research and practice through information technology. It is highly informative and eye-opening for all our nursing fraternity, how to move about the dissemination of research findings. So then only it will be reaching to the root to the practice. So it is a thought-provoking session. Following that, 11 to 11:30, so Mr. Vidoba Narayanan Magilkar, Assistant Professor from Psychiatric Nursing Department, he has delivered a topic on reason behind our vibrating smile for a healthy lifestyle. So the need of the hour, he has emphasized the audience to become happy and healthy. To become, we need to smile and make people also to smile. So that is the importance. It is the need of the hour. Also, he has emphasized. And between 11:30 to 12, another session was followed by Dr. Sama Anwar Muhammad, Associate Professor of Fundamentals of Nursing, Alexandria University, who has focused on the holistic approach to caring with compassion. Recorded video was projected. And following that, 12 to 2 o'clock, so our next of the rest of the scientific research papers have been the same way of as like the previous day. 4 halls have been allotted as a breakdown room, and totally we have presented about 40 papers. 48 oral presentation have been held. So we had 4 international speakers, 5 national speakers, and keynote sessions. We had a 115 papers presentation in which 7 international paper presentation and 108 paper presentation from various parts of India. Among this paper presentation, 17 faculty from SRM College of Nursing, 15 students from SRM College of Nursing presented their papers. The best 2 papers in each hall for the 2 days are awarded with the concurrence of Society for Nursing Practice. They accepted to give minimum 2 prizes in each hall, each day. So that it has been also, I thank all the teachers who have helped in evaluating the paper and to bring out with the presenter of the prize winners also. And these people will be given a certificate. So also for their presentation. So it will be announced following the end of this program. Yes.
Thank you, ma'am.
Yes.
Next, we would like to have the feedback.
Yes.
Representative from the student side, Mary Francis, and the faculty side, Gilino from Philippines.
Mary Francis, you have access. You can unmute and talk.
Good afternoon, everyone.
Good afternoon.
Hello, can you hear me?
Yeah.
Hello? Hello?
Yes, Mary, you can start, Mary.
Oh, okay. Yes, ma'am. Good afternoon. I'm Mary Francis from SRM College of Science and Technology. And I would like to thank the whole people that coordinated this event, the team ma'am, the faculty, and all the staff that hosted this amazing conference. I would like to say it was an eye-opener. It has given me a lot of insight on the whole community of nursing. And we have also learned a lot, and we're hoping that we will apply all this that we have learned in our future workforce and in future, knowing how to make more research and take initiative to come up with innovative solution in the nursing sector. I say thank you very much. I appreciate. Say God bless you and thank you, everyone. Thank you.
Thank you, Mary Francis. Next, I'll call Jillian Bijo ma'am from Philippines.
Okay. Good afternoon, everyone, and thank you so much. So, for me, I would consider this as a very long journey with particularly Dr. Gopinath, who has been collaborating with the College of Nursing of Cebu Normal University in order for us to take part in this prestigious activity with HRM and that of SNDP and Bioleague. So we would also extend on behalf of my colleagues who are also presenters in this conference, we would like to express our heartfelt gratitude for the opportunity given for us to share in our research findings and also to learn much from the different talks of the invited keynote speakers and experts in this conference. And I believe the glitches that we had with regards to technology are unavoidable, considering that we are on a virtual platform. But nevertheless, I would say that the conference is successful indeed. And thank you so much for all the initiatives that that the organizers have exerted in order to make this event possible. So once again, congratulations to the organizers, and thank you so much for giving us the chance to be part of this endeavor. That would be all. Thank you.
Thank you. Thank you for your valuable feedbacks. I now request our Dean Ma'am to announce the Best Paper Presentation Award, and I request Jillian to share the screen.
Yes, ma'am.
Yes. So I need a full view, ma.
Yes, ma'am. Ma'am, is it okay, ma'am?
So the view is okay. Sorry. No, you have to go for maximize. It's not visible fully. A part is hiding.
Jayan, I think you have spotlighted. It's showing half up.
Okay, ma'am. இல்ல மேம் ஸ்பாட்லைட்ல இல்ல மேம்.
இல்லங்க சிஸ்டர். ஷேர் ஸ்டாப் பண்ணிட்டு மறுபடியும் ரீஷேர் பண்ணுங்க.
Yes.
One second ma'am.
Is it possible, or I will take a printout and read? Now it's good. Yeah. So here the first day In the hall, evaluator by Agila and Priya. So the Florence Nightingale Hall. So this one. So the first prize goes to Anita from Vinayaga Mission. The study on effectiveness of slow fast breathing exercise on labor pain perception among primary mothers during first stage of labor. And the second prize goes to AIMS Need2. So that is the effect of vitamin B6, B9, B12 supplementations on homocysteine level and AMP. What is the AMP? There is a short term cardiovascular outcome in stroke patients, a meta-analysis of randomized control trials. The second prize. The next hall, Muma. The name of the evaluator Abhirami, and along with Tamil Chelvi. So that first prize go to Johnny Yo. So that title on elderly seniors versus youthful seniors, attributions and reshaping of aging experiences, expectations. That is Philippines, Cebu Normal University, Philippines. And here there is a two prize it goes for Philippines. I congratulate the people. Second one, the granular lockdown through network modularity analysis by Jessel. Second prize also again it goes to Cebu Normal University, Philippines. I congratulate people from Philippines. Take up 2 prize certificate. And the third room, Professor Kalavali and Geeta was the evaluator, and the first prize goes to Professor Chetna Joseph, a pre-experimental study to assess the effect of pedagogical communication measures on a patient with dysfunctional communication admitted in selected hospital at Madhya Pradesh. So Chetna Joseph, principal from and the PhD scholar of that from Madhya Pradesh. And here the second prize goes to Jay Bharati. The study title on to assess the effectiveness of music therapy on reduction of stress and anxiety during labor among parturient mothers from Vinayaga Mission, India. Yes. And the next room is by evaluation by that is Ambiga and Valarmati. So that prize of first it goes to Malarkudi from AIMS. The title on perception, perceived scope and potential barriers regarding the implementation of independent nurse practitioner. Second, it goes to again from Philippines, Cebu Normal University, Julius Colonia Dano. Sorry. So the title on I am not, the experience of nurses frustration in clinical setting. Very nice. 4 prizes it's going for Philippines. That's total 67 papers, day 1, and 63 national and international 4. 4 international it got into prize. So I congratulate the university from Philippines. And second day, today presenters from the hall 1. So that it is first prize Pamba Bhushal from SRM College of Nursing. A study to assess the level of knowledge regarding intramuscular injection among undergraduate students, SRM College of Nursing. And second prize goes to Delhi, AIMS, that is, I don't know Delhi or which branch, but it is not mentioned, but it is AIMS Delhi, Ujjwal Dahiya. Anxiety, stress, depression, and adherence to immunosuppressive therapy affect quality of life in kidney transplant recipients. Second prize. And in the next room, the evaluation by Shiba and Selva Mary. The first prize to Vinayaga Mission, Ruba, Professor Ruba, biopsychosocial problem of infertile woman. And then the second prize goes to again Vinayaga Mission. This is Gomati, respiratory health and morbidity status. Congratulate for the Vinayaga Mission University. And the third room evaluation, it comes Ramya and Suganti, the evaluator. And the first prize goes to again Philippines. So that social factors as antecedents of depression among community dwelling older person. So by person holding that Gillian Bijos from Philippines, Normal University again, the first prize. Second prize for SRM College of Nursing, Malini, student, second prize. That is, the title is a study to assess the effectiveness of cryotherapy on arteriovenous fistula puncture related to pain and behavioral changes among patients on hemodialysis in SRM General Hospital, Katangulathur. Next, in the next room, the evaluation by Dina Jyoti and Selvi. So the first prize goes to Malarvili. So I'm very glad. So the last moment presenter, peak flow monitoring for guided self-management on health outcome among adult asthmatic patients. And second prize goes to ITM University. That place, it is not mentioned where it is, and Sudha. So she is the title on effectiveness of STP module on knowledge regarding prevention and home management of leukorrhea among adolescent girls studying in selected higher secondary school, Damo. So the second prize. So totally today we had a presentation of 48, out of which 45 from the scientific papers from national, and international is 3. Total 48 presentation we have. So above all, overall 2 days total paper presentation is 150. Yes. I think only 1 or 2 missing. I think 117 we had in the schedule, but 115 already either through some way through video, and most of them, more than 90%, they presented in person, and few with through video. Even that videos also, I want to make a mark on that. The COVID situation, the ICU nurse also can be given special certificate for the video presentation. I think I can recommend for, because she has given COVID diet, how it is maintained in the ICU sector. She has, in my room I assessed, and I don't know about the other room. So if anyone is valid, so we can even give some certificate of a special appreciation for that also. It was very good. I observed, and she covered, the video was very excellent, and she presented highly informative in that video. Thank you for the opportunity. Here I am thanking all my faculty along with that COVID scenario or lockdown, too many obstacles. And special thanks, I have to thank all the faculty who have extended help for the successful conduction of this virtual mode. So that from Society of Nursing Practice, the coordination by Priyadarshini, Abhinami, Gila, and even though some of the obstacles we have, the vice principal is also extended help from the beginning to till end. At the moment, last moment, even though she couldn't able to share some of the thing, so our faculty has managed, and I'm very happy. But even in that condition also, she was extending their full support and help from the beginning. Professor Vijay Lakshmi was extending her help enormously throughout the conference. And final touch, some of the aspect we couldn't able to in these within 2-3 days, whether we can able to do it in a successful way. There was some little bit his fear I had, because we are in the lockdown phase. That's what. Otherwise, I have hope in all my faculty. So we just break through that also. I congratulate each and every one of you to extend your full cooperation to complete the 2 days international conference without much problems we have undergone, and all the cooperation from that Society of Nurse Practice, so, SFNP, and then the BioLeague extendedly they have helped us with a new forum for us, that is auditorium view and live view, a lot many things. It is a new thing for us. So it is an opportunity for each and every one of you. And then for us also, we have taken into consideration, and we will try to fulfill the gap where we are, that the nursing research, it is not into put into the practice. That is the concern for each and every one of us. And we will move further to implement into a practice, and we will improve the quality at the bedside. So that is the assurance all our faculty and students will have eye opening on this, and all other participants throughout the globe. So also extendedly they have given their contribution and presentations. Really it will be more helpful for our nursing fraternity. I am thanking the organizing body of BioLeague, and then the NP and the SPNF. So they are also from the beginning. So the CEO also came and visit me, and I am really thanking the Gopinath, who is even now a little bit sick, but beyond to that, he has extended all his cooperation for conduction of these 2 days international conference. I am thanking each and every one of you. So for a very good future, and in future also we will have collaboration with you both, the BioLeague and that nursing society. So that the Society for Nursing Practice. So we will have a good that MOU if possible, and we will have collaboration with you in future also. Thank you. Thank you for the opportunity as being a co-secretary of this 2 days international conference. Thank you.
Thank you, ma'am. Thank you, Dr. Kanyamal, ma'am. It's happy to hear that we'll be having further collaborations with SRM. On behalf of BioLeagues and SFNP, we express our gratitude towards SRM College of Nursing for coordinating and giving us an amazing presentation from your college. Great researchers. We see a bright future in the nursing science, and to be a great contribution given from SRM College of Nursing. So, and thank you to all the other participants who has participated from various colleges across the globe. Thank you so much for being part of SFNP. And I would like to clarify a few queries for all the participants regarding the certificate and the conference proceedings, and as well as the feedback forms. So I'll be sharing my screen now.
Yeah. Yes.
So as I explained yesterday, you can log into virtual at icnh.com. I hope my screen is visible. So as usual, you can enter the hall.
Yes.
So as we are entering the hall, you can see at the bottom, we can click here for our certificates.
Yes.
And you will be redirected to the SFNP page. as it is like all the participants are provided with 1 year free membership from the Society for Nursing Practices. And all you have to do is just fill up your details here. You have to give your name, email address, and just as we usually enter for all the other platforms, and agree and join, and you will be redirected to the certificate page, and over there you can download the 1 year free membership of SFNP as well as your conference certificates. Even though if you have any queries regarding downloading or anything, you can write back to us. We will help you in getting it via the emails as well. Now, regarding the conference proceeding books, as you know, we are conducting a virtual conference and it's not possible for us to reach the physical copy or hard copy of the proceedings to each and every one. You have the option to download the conference proceeding right over here, and all the soft copies will be available to all the participants here. And if you would like to know about SFNP, you can click over here. And I request everyone to kindly fill up the feedback form, which is available over here in the right corner. And it will be nice to hear your feedback and let us know where we can improve and how we can collaborate in the future. So please do fill up the feedback forms and submit over here so that we can know how you feel about second ICNH 2021. And any further questions? So that's it.
So if it comes, we will clarify with you, madam.
Sure. That's
yes.
No problem about it. Always welcome. And even any other participants, you can write to the conference mail address itself regarding anything about the proceeding books or certification. And you can reach out to us at any time. We'll make sure that we clarify at the earliest.
Yes.
And all those who have missed the sessions, you can subscribe to SFNP Society for Nursing Practice YouTube channel. The complete day 1 and complete day 2 video of all the sessions are uploaded on YouTube and they are streaming live. So you can watch all the sessions at your home comfort and you can get back to us. So do subscribe to SFNP channel and watch all the sessions. So thank you once again to Dr. Kanyamal ma'am and SRM College of Nursing. It was nice to have your college and conduct second ICNH in a very grand way. Thank you so much, ma'am.
Yeah, thank you so much. Thank you. She would luck. Be
Thank
safe.
you so much,
Stay safe.
Sure.
Yeah. Yes, madam. Yeah.
Thank you, ma'am. To express a word of appreciation and gratitude, we have with us Professor Akila Devi, who could propose the vote of thanks.
Yes.
Akila, please.
Yes, thank you, Shiva. Good afternoon to everyone. As we end today's event, I would like to thank you all for joining the second international conference. Your presence today shows a strong commitment towards learning. On behalf of SRM College of Nursing, Bioleagues Worldwide, Society for Nursing Practice, first of all, I extend my sincere thanks to all my team. I also extend my sincere thanks to SRM management who will give continuous support in all our endeavors. My heartfelt thanks extends to our dean, SRM College of Nursing, for her expert guidance, her words of encouragement, her able guidance has always encouraged us, and I thank for her kindness, her interest, her hospitality, and continued support. Thank you, ma'am. I thank the management of Technorate and Bioleagues Worldwide, and thank Mr. Rudrabano Satapathy, founder and CEO, Technorate Group, Bioleagues Worldwide. And I thank Ms. Jasila Mustafa, Scientific Research Analyst, Bioleagues Worldwide. And my heartfelt thanks also extends to Mr. Gopinath, Program Coordinator, Society for Nursing Practice, and also I thank this technical team for their extensive support and cooperation in organizing this conference. My sincere thanks to all the expert speakers for the past 2 days, that is Dr. L. Gopichandran, Associate Professor, College of Nursing, AIMS, Mrs. Andu Chetty, Educationist and Infection Control Preventionist, Singapore, Dr. C. Kaniyamal, Dean, SRM College of Nursing, SRM IST, Dr. Emiliano Ian B. Susan, Chief College Dean, Cebu Normal University, Philippines, Dr. Vidya from King Faisal University, Saudi Arabia, and Dr. R. Revati, Principal, Velama School and College of Nursing, India, and Dr. Rita Lakhani, Principal, D.Y. Patel School of Nursing, India, and Dr. Sama Anwar Muhammad Shalabi, Associate Professor from Alexandra University, Egypt, and Mr. Itopa Narayan Malkar from Institute of Psychiatry and Health Behavior, India. For their valuable contribution and sharing their expertise with us. I thank Vice Principal and the SNO for providing continuous encouragement at every point of time in the organization of this great event. And also I extend my thanks to Dr. P. Abhirami and also Priyadarshini for their extensive work towards this conference. And also I thank all the faculty members who are working hard behind the screen and on the screen for their and also I thank for the enormous cooperation in organizing this event. Especially I thank the technical team members, Ms. Jelen, Ms. Deepika, Mr. Vijay Daniel, Ms. Priyadarshini, who are working for the past 2 days nation conference. I especially thank all the delegates and the paper presenters for their participation and made this conference a successful one. I close my speech and thank everyone once again for their sincere efforts. Thank you, one and all.
Thank you, Akila. Now let us all stand for the national anthem.
Excuse me, ma'am, just a moment.
Yes, yeah.
Actually, I forgot to explain to the participants that as they are receiving the SFNP membership, they are also welcome to the next nursing conference, which is happening in Dubai. So they will be receiving the privileges for that also. Can I just share my screen?
Yeah, yes, yes.
Yes, so all the participants who have joined here now for the second ICMH, as they are getting the free membership of 1 year of SFNP, they'll be having the privileges of attending the Asia Pacific Conference on Nursing Science and Healthcare, which will be happening on the 1st and 2nd of December at Dubai. So the registrations are open and everyone is welcome to submit their abstracts and join us there as well at Dubai. And if you are unable to travel, you can register for the virtual slots also. So
Okay.
thank you so much, ma'am.
Because of the COVID, we have to keep our view open for any forum. Yes.
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 Sure,
Thank
no
you,
problem.
madam.
Thank you.
Thank you, madam. Thank you, one and all. So it is almost we are foregoing lunch, no problem. So that we are getting lunch for the brain, not for the stomach now. Yeah. Yes.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे
Let us all be guided by all the things we have learned and heard throughout the conference and be able to see and influence our future. Thank you one and all once again.
Unmute yourself, ma'am.
Thank you all. Extended lunch time. Now you can have your lunch. And we didn't have any hungriness, no, because we were very busy with all attending paper presentation videos. And I never felt, I don't know, I had 3 idli in the morning, but I never felt that. But anyhow, all of you go and take rest and then have your lunch, late lunch, and meet you soon after some meeting. Okay, thank you all. Thank you, the participants.
Thank you.
Yeah, thank you. Yeah. Jeline, we can leave?
Yes, ma'am. Yes, ma'am.
Oh, yes, yes. So the special thanks for the team already I told, and everyone they expressed, and you need to still grow. You might have learned many things through this conference also, some more adding to, yes. And we have to take some good points, whichever we learn, we will put into our college development and your personal development as well.
Yes.
Thank you, Jeline, Deepika, and Vijay, and Priyadasni. A special thanks once again. And Dr. Abhirami and Agila all have extended the last moment help. So all the teachers, mostly everyone you have helped. So that it shows the unity. I am very happy. So I'm thanking each and every one of you directly or indirectly, the evaluators of the sessions. Also, I'm thanking. So to make it start immediate evaluation, to give back that certificates for the announcement of the today session also. So I'm thanking the evaluators, special effort for that. So last moment, but immediately they have accepted to give a special certificate for the first, second, at least something, because many papers are there. So I requested, and they too also I'm thanking the SPN, SFNP, and then the Bioleague. Whatever we have asked, they have helped us so to grow. So I'm thanking each and every one of you. We can wind the session. Thank you. Yes,
Thank you.
Yes, ma'am.